Hafa-day, good morning everyone. Welcome to the Guam Congress Building. The Committee on Health, Land, Justice, and Culture is now called to order. Today's April 18th, 2023, and the time is 8:13 a.m. In compliance with the open government law, notices for these public hearings were published in the Guam Daily Post and posted to the Government of Guam Public Notice Portal on Tuesday, April 11, and Friday, April 14th, 2023. Notices were also sent via email to all senators and all main media broadcasting outlets. This hearing is being live streamed via the Guam Legislature's YouTube channel. Individuals testifying shall first be recognized by the chair before speaking and begin by stating their name for record-keeping purposes. There are 3 agenda items this morning. Bill number 77-37 LS, introduced by William A. Parkinson, an act to amend Section 22-101 of Division 2, Chapter 22, Title 10, Guam Code Annotated, relative to extending the validity of health certificates from 12 months to 36 months. Bill number 92-37 COR, introduced by myself, Therese M. Terlaje, an act to add a new Article 9 to Division 1, Chapter 4 of Title 26, Guam Administrative Rules and Regulations, relative to the adoption of rules and regulations governing barber and beauty shops, cosmetology schools, and nail salons, attached hereto as Exhibit A. And Bill number 93-37 COR, introduced by myself, Therese M. Terlaje. It's an act to add a new Article 26 to Division 1, Chapter 4 of Title 26, Guam Administrative Rules and Regulations, relative to adopting rules and regulations governing institutional playgrounds, attached hereto as Exhibit A. I'd like to acknowledge the presence of my colleague, Senator Tom Fisher, this morning. Thank you, Senator, for being here. Good morning. We'll begin with the first agenda item. This bill was introduced by Senator William Parkinson, and he is off island right now, but has asked for me to read his opening remarks, his introduction of the bill. So again, Bill 77-37 is an act to amend Section 22-101 of Division 2, Chapter 22, Title 10, Guam Code Annotated, relative to extending the validity of health certificates from 12 months to 36 months. So this is Senator Parkinson's statement. Bill number 77-37 seeks to extend the validity of health certificates from 1 year to 3 years because securing and renewing a health certificate every year creates an inconvenience and barrier to those seeking employment in industries that require one, most especially the food and beverage industry. It is absolutely vital that we do everything we can to remove barriers to employment. This measure will help people be employed in our local workforce and contribute to the island's economy. So this bill was introduced on March 7th and referred to the Committee on Health on March 8th, 2023. We've requested feedback from the public and especially from the Department of Public Health and Social Services and the Guam Hotel and Restaurant Association. We'll now receive testimony, and we'll go in the order of those who've signed in. It's Francis Salas, and then I think Charlene St. Nicholas. All right, so Francis Salas. Are you both from Public Health?
Yeah, yes.
Okay, so you go in the order you'd like.
Hi, so on behalf of Director Art San Augustine, I am the acting director for Department of Public Health and Social Services. Written testimonial for Bill 77-37 was submitted to your office, Speaker, and at this time I'm going to go ahead and request Acting Environmental Health Chief Francine Salas to go ahead and provide the written testimonial.
All right, but could you please state your name and position for the record?
Charlene St. Nicholas. I'm the Acting Director for the Department of Public Health and Social Services. Thank you.
Good morning, Speaker, Senator Fisher. My name is Francine Salas. I'm the Acting Chief Environmental Public Health Officer, and I am reading Director St. Augustine's testimony regarding Bill 77-37 LS. Hafa-day, Madam Speaker, Therese Terlaje, and the members of the 37th Guam Legislature. I'm Arthur U. St. Augustine, the Director of the Department of Public Health and Social Services. Thank you for allowing me the opportunity to present testimony on Bill 77-37 LS, an act to amend Section 22101 of Division 2, Chapter 22, Title 10, Guam Code Annotated, relative to extending the validity of health certificates from 12 months to 36 months. Section 22104 of Division 2, Chapter 22, Title 10 Guam Code Annotated, and pursuant to the Administrative Adjudication Law, authorizes the Director of DPHSS to establish and modify by regulation the requirements and fees for obtaining a health certificate. In 2015, then Director James Gillen utilized such authority and revised the health certificate regulations, which were adopted and enacted as Public Law 33-0202. These rules and regulations are established to ensure that the holder of a health certificate is free of communicable diseases that could potentially spread to fellow employees or their clients as a result of the holder's work activities, and/or possesses the minimum knowledge in preventing the spread of communicable diseases at the health-regulated establishment where the holder is employed. The Division of Environmental Health, or DEH, issues several types of health certificates. They issue the health certificates required to work in restaurants and other food facilities, child care establishments, therapeutic massage facilities, cosmetic establishments, laundry facilities, and other health-regulated establishments. Applicants applying for their first health certificate for a food facility must get a PPD skin test, verifying that the employee is free from infectious tuberculosis, and attend and pass the interim safety health certificate course. Those renewing their health certificates for employment at a food facility do not need to get a skin test, but must complete the refresher food safety health certificate education course every year. For all other categories of health certificates, a PPD skin test is required for all new and renewing health certificate applicants, and a physician's certification attesting that the applicant is free of communicable diseases. Should Bill 77-37 pass, the lack of an annual PPD skin test and an annual physician certification poses a threat to the people that these health certificate holders serve and cater to. It is no secret that DEH, or the Division of Environmental Health, is unable to conduct routine, frequent inspections of the island's nearly 3,000 health-regulated establishments to confirm compliance with the sanitation standards in the prevention of disease transmission. Yet Guam has been very fortunate that it has not had a major disease outbreak for nearly a decade. The last significant outbreak occurred in 2011 when 357 students and staff of 5 southern public schools became ill with foodborne illness. While there may be several reasons for this, we believe the island standards governing the sanitary operations of these businesses, including the implementation of the current health certificate regulations, is the primary reason that we do not have recurring disease outbreaks associated with these establishments. The annual health screening and/or food safety training required to possess a health certificate are proactive, thus preventative measures to protect island consumers. It's important to add that the absence of reported outbreaks in the last 7 years does not imply that disease transmission does not occur at regulated businesses. In fact, we are certain it does, based on anecdotal stories, data, and inspection results. Even if no illnesses are occurring at any of the island's 3,000 establishments, the threat continues to exist as demonstrated in our recent restaurant closures. This fiscal year to date, DEH suspended the sanitary permits of 12 food facilities due to unsanitary operations of the facility, including poor handling and food handling practices of the employees, which only emphasizes the need to provide continuous training to health certificate holders, such as via the annual training required in the health certificate regulations. Please note that most foodborne illness outbreaks in the United States are linked to food handlers. Locally, the most commonly cited violations of eating and drinking establishments are inadequate hand-washing facility, cross-contamination, and improper storage of food, which are all associated with improper food handling or hygiene of a food handler. Another concern of Bill 7737, which we cannot ignore, is the loss of revenue that will result if enacted. The Environmental Health Fund, known as EHF, is a major source of funding for the Division of Environmental Health for operations and personnel. EHF derives its funding from the issuance of health certificates and sanitary permits. Over 30,000 health certificates are issued annually, and nearly 90% who receive the certificates are food handlers employed at food facilities. On the average, $1,182,468 is generated annually and deposited into the EHF account for use by DEH. An average of $372,023 is generated annually from the issuance of about 33,808 health certificates, which comprises of 31% of the Environmental Health Fund. Utilizing the revenue data for health certificates spanning the last 12 years, that's from 2011 to 2022, if revenue from the health certificate was collected every 3 years as proposed in Bill 7737, a total of $1,488,091 would have been collected. Thus, $124,008 would have been generated annually over the 12 years, which is a third or 33% of what was generated over the same period from the annual issuances of health certificates. You're looking at an average of $372,023 versus $124,008. So should Bill 77-37 be enacted, only a third, or 33%, of the current revenue from the issuance of health certificates will be generated and deposited into the Environmental Health Fund. DH recently increased its fees for sanitary permits effective November 2021. DH conservatively anticipates an increase in revenues by about $235,000 annually. The increase was proposed with the main goal of recruiting additional inspectors. So should Bill 77-37 be enacted, the average loss in annual health certificate revenues of about $248,015 will outweigh the potential gain from increase in sanitary permit fees. Thus, the division's efforts and plans for growth to meet its 25 mandates will be further challenged should Bill 77-37 pass. And results in the underperformance of the Environmental Health Fund. As a result, DH will be left with less fiscal resources that will impact existing personnel who are already overtaxed in meeting the mandates of the division, and may lead to additional resignations due to the overwhelming amount of work and the sense of loss of support of their role in lifting the work of environmental health in our community. Therefore, DPHSS proposes a corresponding increase to the health certificate and associated fees to avoid any reduction in critical revenue for the Division of Environmental Health as a result of extending the validity of health certificates from 12 months to 36 months. While the department understands that the annual renewal can be viewed as a barrier to employment, this legislation, should it be enacted, poses a public health risk, and it will hinder operations of Division of Environmental Health, the same division that is responsible for implementing the island's environmental health programs, including the inspections of health-regulated establishments such as schools and restaurants. Thank you very much. Sizuas Masi, Arthur U. St. Augustine, MHR Director.
Sizuas Masi. For the record, the committee's also received written testimony from Othelia Rose Taitano Figueroa, Familian Sarut, Sinahanya. We have a fiscal note, according to the Bureau of Budget and Management. Based on information from the AS400 financial management system from the FY17 through FY22 revenue collections deposited into the Environmental Health Fund from health certificates averages approximately $472,800 per fiscal year. The proposed legislation's intent to make health certificates valid for 3 years as opposed to the current validity of 1 year may result in the aforementioned average revenue collection of $472.8 thousand being reduced to a third of the average collection, which translates to approximately $157.6 thousand a fiscal year. The Bureau notes that unless the fee schedule for health certificates is adjusted, a reduction in revenue collections from the Environmental Health Fund can be anticipated, thus reducing available resources for Department of Public Health Social Services operations from this particular fund source. I guess that's consistent with what you've testified, Department of Public Health. All right. I would like to also recognize the presence of my colleague, Senator Terlaje. Good morning, Senator, and thank you for being here. All right. So I have a few questions. Yeah, so first of all, when in your testimony you said that 90%, there are 30,000 health certificates issued annually, and nearly 90% who receive the certificates are food handlers employed at food facilities. But didn't you also say that for food facilities, those are not renewed annually, the health certificate? Or no, they don't need a PPD annually, but they take a refresher course annually. And so you think the refresher course, you're saying that's adequate right now to prevent communicable diseases?
So I see our division as having sort of a two-prong approach to protecting the public. We see it as, on one end, providing education to mitigate risk, but also the enforcement arm, which, as we see, we're unable to meet due to the shortage of staff. So we can acknowledge that maybe we need to increase, the brevity of our course. But actually, for the past quarter, our division has actually started taking surveys of our health certificate training course attendees. And although our averages are kind of off because it is only one quarter, and we actually like to do an annual average where we started taking the surveys, the commentaries received are really appreciative of the refresher of the information. Some people have been doing this for 10, 15 years. Those individuals come in, they do it anyways, and they're fine. But there are some who really appreciate the refresher. And as we've seen in the news, even though some of these individuals have valid health certificates in some of the establishments that we've inspected, what you're finding is the need for the refresher remains evident. And so if we sort of address the education portion while we're trying to build up the capacity to build the enforcement arm of the division, then I think that can be met successfully in protecting the people.
All right, and what is the fee for renewal of a health certificate? Or for an application for a new one and then the renewal?
So it really depends on the category of health certificate. So if you are getting a food facility health certificate, or food handling or F&B, you would pay $10 for the health certificate, and there would be a mandatory $15 fee for the course. Upon renewal, because you are doing the refresher course and you're getting the health certificate again, it's another $10 and $15, so for a total of $25. For all other categories, it is a $10 fee just for the health certificate.
And on renewal?
It's the same.
Same.
For all the categories.
$10 every year.
Yeah.
So they don't need the course.
No, for every other category, there currently are no other courses. Although the current statutes does allow for the director and the regulations to develop additional courses.
All right, so to summarize, for food facilities, you give health certificates to different categories, but for food facilities, they're required on application to get a PPD test. They are required on every year on renewal to get a refresher course and to pay $25 every year.
Yes. For
Okay.
you who handle the food facilities, yes. It's
All
the
right.
course plus
That's
the
for the course and
certificate.
for the license?
Yes,
Or the
that's correct.
certificate? And for all other categories that you give a health certificate to, they are required to get a PPD on renewal. And they are also required to get a physician certificate that they have no communicable disease, and they pay $10 per year.
Yes,
Okay, thank you. And the categories, again, could you just state those for the record?
sure. The alternate or the other categories beyond food facility are therapeutic massage, institutional, which includes working at childcare facilities, daycares, adult daycares, but there's also cosmetic establishments, laundry facilities, and tattoo, and I believe that's it. Yeah.
Okay, thank you. All right, I'm going to open it up to my colleague, Senator Fisher. Any comments or questions?
Thank you, ma'am. What is a PPD test?
As I understand it, it's one of those tests that you go and take to see if you are, as I say, infectious for tuberculosis. It's administered by a clinic. You go in, you get the test done, you come in a couple days later, they read it to test how big that bubble is on your arm, and then from there, the physician ascertains whether or not you're considered infectious, and that's pretty much it.
Is tuberculosis a communicable disease?
It actually is. It can be, yes.
Why is there, in the food industry, service industry, why is there such concern about tuberculosis?
Hang on a second. I'm going to take a stab at it, Senator Fisher, but unfortunately, the Division of Public Health would know more information, as it seems to be more in their field. They would, from our perspective, it is considered, and it's in our statutes, that they need to be free of the communicable disease, including tuberculosis, and so we just carry out the information or the mandate according to statute.
Okay. And has the Department of Public Health and Social Services, exercising your expertise in this matter, have they determined that it is appropriate for public health to have a test once a year for PPD, for example, and healthcare certificates?
We have not done the assessment, if that's what you're inquiring. That's
Oh,
something.
no, I guess what I am asking is, does the Department of Public Health think it's appropriate to have yearly testing?
Do we think it's appropriate? Well, right now, part of the current requirements for the health certificate is the PPD. So that's what we have right now in terms of those submitting their applications for the health certificate.
Okay, and that happens yearly?
Yes.
And is that, do you have that happen yearly in order to protect the public health?
It's part of the requirements for the health certificate. So any food establishments, as Francine's mentioned, that are operating, that need to comply with having the health certificates, that's part of the requirement, and it's been on our application. So it's something that we've continued to follow.
And do you think that's appropriate, the 1 year?
Well, right now, because we do have it as part of a requirement, then yes, it is appropriate.
Okay.
Thank you.
Thank you. Then I would, Madam Chair, I could not support this bill. I would defer to agency expertise.
Thank you.
Thank you, Senator Fisher. Senator
you.
Teitzke, you're recognized.
Thank you, and good morning, Madam Speaker. My apologies for being late this morning. I did, technology keeps you connected, so I was able to listen on the YouTube while coming down here, and I just see all these individual people here. It's good to see the next generation and future senators sitting in front of me today, so I encourage you to stay focused and, keep on top of things. Something like this is, it's very two-sided. It weighs out. very much so. You have those who feel that, every year is too much. You also see a drop in funds, a big drop. I'm reading the financial report here, and according to your testimony, as I was coming in, you stand to lose $200,000+ a year if this bill were to pass. Is that correct? About $248,015.
Yes,
Okay.
Senator. The fiscal note provided by BBMR, our figures are a little different.
Yeah.
We did a 12-year average, and they did a 6-year. We wanted to factor in sort of make sure that COVID wasn't a big part of the numbers, to give a full 12-year assessment, especially since the bill proposes to renew every 3 years. So we wanted to do that as well.
Okay, and currently right now, and I'm sorry if you have to repeat the, answers, but it's every year that they come in for a renewal, correct? It's $25 first initial, then $10 every year for renewal. Is that the?
Actually, it's $25 for the initial for food handlers. That is the interim course plus the $10 health certificate.
Okay. 35 total.
25.
Well, food handlers, and then $10 for.
Then renewal is the same fee, but it's a different kind of course. It's a refresher course, and in addition to the $10 health certificate fee.
Okay, so it's $35 every year.
25.
Oh, you subtract the 10.
No, so sorry, 15 for the course and 10 for the health certificate.
Okay,
So
that's on a renewal, correct?
yes, so that's the initial and the renewal.
And you mentioned that the course on the renewal is usually different. It's.
Yes, it's an abridged version. It's sort of a short reminder of the key targets. Sometimes our health inspectors also like to focus on maybe re-hone what was recently targeted or found in their inspection results. So as a reminder for safe food handling purposes.
In these renewals, are there any opportunity, or not opportunity, but are there any information provided to individuals about how to recognize certain things, not just the individual, making sure their hands are washed after using the bathroom, after touching certain things like that, but do you also train them on to recognize if the facility, like the restaurant, is not complying themselves on different perspectives, like, seeing that there are rodent droppings behind a refrigerator and that the individual is not paying attention, and how this individual can actually, be a whistleblower without getting in trouble, things like that. Do you also train them with respect to that?
Absolutely. In addition to you as a food handler, we see that it's important for you, obviously, to take care of yourself in terms of practicing proper hygiene, being clean, not coming to work when you're sick to potentially make others sick. But in addition to that, just sort of practices that they need to instill in their workplace, just to make sure that the public doesn't get sick based on how they prepare the food and how they handle storage of things in the facility.
And my last question. When you have individuals who've come every year to get, continued education, have you found that individuals who've come, like, for the last 3 years actually didn't know certain things and you remind them of it, or you find that they don't clearly understand everything after 3 years of coming to you every year? Have you come across that?
Yes, we have. The refresher's kind of nice, as well as I think a lot of people who didn't work during COVID in food service also sort of forgot some of those practices, those good practices that we teach. But it's something they forget or they didn't know. The health certificate for a food facility is portable. So you can take it to any type of business that requires a food facility health certificate. So for example, you can be a barista at a coffee cart, and then you can also work at a restaurant. And so those practices, the person who did it for 3 years at the coffee cart may not be fully aware of everything that goes on in a kitchen, and so that information may be new and now is applicable to them.
Okay, well, thank you so much, and I'm sure that this funding or this fee that's required is national, or it's lower than the average in other states and territories. Is that true?
That is data we don't have at present. I know there's a variety of states that have different kind of policies, and also different mechanisms in which to build in health education to the business owner operators as well as the people working there. But we could definitely get that information
Can
for
you please? Yeah, I'd like to see what Hawaii charges, you know, I mean, something close to what Guam does. Yeah, I'd like to see that. Sure. Okay, and thank you, Madam Chair.
Thank you, Senator Taitzugui. Senator Barnett.
Thank you, Madam Speaker, and I'm also sorry I was late. I came all the way from the south and it was raining, and my mom makes me drive slow when it rains. So, good morning. Thank you for coming out to testify. I just wanted to ask if this bill and what it's offering has prompted any action on the Department of Public Health to kind of look at because you understand the intent of the bill, right, is to ease the burden on those service workers. I don't know if I'm the only one up here who has actually had to go and get a health certificate. I started my career in fast food, Popeyes at Gibson's. But has there any thought been given to look at some of the intent behind this bill to maybe streamline or make it easier for service workers and applicants to avail the health certificate process?
Yes, actually, our department continually strives to improve customer service, improve the turnaround time. We understand that these individuals work primarily most of the day, some in the evenings, some have 3 jobs, and so we try to accommodate as much as we can. We do offer a few options, actually only one option presently, which would be for them to come and then have the ability to, if it's a renewal, to test out. If they feel that they're knowledgeable, and we provide all the material on our website for them to review in preparation of, and basically test out upon renewal to see if they adequately meet the requirements of understanding basic food handling safety. We are also looking to expand our education, we got a grant from the Department of Insular Affairs for a CIP grant of roughly about $9.5 million, almost $9.5 million, to build an educational facility. So this is a plan that we have in the works that will add the ability to offer more students to attend one class at the same time. But we've also looked into possibly moving in the direction of, I don't know if anybody's been to the DMV in the States where you can just go in, take the test on site, and then as soon as you register and out the door. So that is definitely there, just to kind of accommodate everybody's schedules. And I think we're also looking to expand our scope and giving them the opportunity to perhaps schedule online so that they can just, the day they come in, they know, and then they're out the door. And so that's probably what we're working on right now.
Thank you, ma'am. Thank you, Madam Chair.
Thank you, Senator Barnett. Senator Duenas. Good morning to Senator Chris Duenas.
Good morning, Madam Speaker. I don't have an excuse slip for being late. I'm just late. I'm just coming clean with you. But I did have a chance to catch some of the testimony while I was en route. First of all, Popeyes has been recognized. I want to recognize Taco Bell because that was my first job and my first foray into getting a health certificate. But I just want to take this time before I ask one question that I think is key to recognize that I also have family members, particularly some who are Manumku, that have actually been doing food service for all their life. And you guys are amazing when it comes to working with persons, who have different challenges and the way that you test out and the way you do your work. So I want to commend the team of public health. You do accommodate and you do a lot, especially when you know that you have repeat people coming back every year that they don't have violations and they don't have, they're not on your radar. You really do work very well with everyone, so I want to commend you. I guess my concern and what I've heard from the representation this morning is that with the inability at this point in time to really do a lot of enforcement with the number of restaurants and facilities that we have, really this seems to be the one area where you have that ability to, as one of my colleagues said, either re-educate or bring things up to date, and to also have that spot check in terms of the, making sure that all the requirements have been met. So I just wanted to see if that would be reiterated, and I don't, unfortunately, as Senator Fisher said, I don't see much wriggle room with this, really. I think we need to keep this regulation in play, and I just need to get that from you before I can make a final decision, or maybe the author will reconsider the bill.
Absolutely. Well, earlier I stated that we view the way in which we're to protect the public is through a two-prong approach, through education and enforcement. And clearly, based on the news and what's been happening, we're not at the ability to meet the enforcement demand due to our lack of environmental public health officers or staffing shortages. So our approach is to focus on the education arm and try to sort of arm our health certificate holders, which is with as much information as they have, in order to do the best they can in mitigating any sort of foodborne illness or any type of communicable disease and the spread and transmission.
Maybe what I'm thinking in my mind is maybe a step from this to maybe get there at some point is that there's this relationship with the businesses and establishments that have these requirements, that they, prepare a self-reporting capability going forward. Like I said, I have problems with this at this point in time because I think, the safety of our people, and when they're going into these establishments, that expectation has to be there. But maybe that's something that can be developed down the line, that businesses say we're keeping up with this and we can self-report into you. Maybe that would be the precursor to something like this going forward. But I just wanted to make sure I confirm that your position on this is it's problematic and the safety of the community is more at hand and important besides the convenience. So, Madam Chair, with that, I think I'm convinced on what we need to do, or what I need to do at least. Thank you for the opportunity.
Thank you, Senator Duenas. Could you just remind us, how long does it take to get a renewal, and for food establishments and then for all others?
So for a renewal for the food establishment, you would complete this tiny form, come down to our processing center section, and schedule, in addition to receiving a temporary upon processing your application, receive a appointment for when you need to come back and do the actual education course, which shouldn't take more than an hour and a half tops. It really depends on, the presentation is roughly 45 minutes to an hour, and then that last half hour is based on how long it takes the individual to complete the test. For all other health certificate categories, the process to come down to our processing center with the completed documents is quite simple and easy. Once you have all the documents in good order, we process the application and the payment, and you pay your $10 and you're out the door. I will say though, on the back end for those other types of health certificate categories, there's obviously some legwork on the health certificate holder on their personal time to go and get the physician certificate of examination, to go and get the PPD annually. So there is some time on that end.
All right, thank you. All right. Is there anyone else to testify on this bill? Turn your microphone on, please. Yeah. Thank you. Please state your name for the record.
Hi, my name is Vanessa Singleton, and I'm with the Child Care at Guam Leadership Academy. I just wanted to mention about health certificates. I understand the importance of it, but it has been a big problem of hiring staff. Before we had clinics that would only charge $35 and $40. Unfortunately, those clinics has closed since the COVID. So now for us to hire a staff, the staff would have to get a health physical, which is $95 and up, plus the cost of the health certificate and the PPD shot. And a lot of the new hires, we have not been able to hire because they don't have the money to afford this. And I was hoping maybe the senators could maybe brainstorm how this could help, because a lot of child cares are opening up more facilities, and we're having problems staffing them because we don't know people, and we can't say, okay, well, I'm going to give you this 200 to go get all the paperwork you need, just make sure you come back. That's a big risk on our part. So that is something I would like the senators to maybe reach out and help us figure out how we can help staff get physicals that are affordable.
Thank you very much, and I appreciate your testimony at being in the the child care industry. There was also a testimony from Othelia Rose Figueroa, who asked whether we could do an online model, such as California and Texas, where they do their renewals online. I know you said you're scheduling online for the refresher courses. Are we able to do applications online?
We actually are looking into it, and it's something in development. Everything takes money to build. I don't know how to say that anymore. And so in building our online infrastructure, it will take a little bit of time, but it is something in the works and the plan.
Thank you very much. Okay, so just wanted to clarify from the sponsor's office that renewals for food facility health certificates do not require the PPD annual renewal annually. Only for all the other categories, it requires a PPD and a health clearance annually, pretty much. All right, thank you very much. All right, there being no other testimony, I'm going to consider the hearing on bill number 77-37 LS. Senator Tydegui?
I apologize, Madam Chair. I just wanted to ask Public Health one question. If an individual who's been, serving food for many years, let's say 30 years, would Public Health be amenable to, if an individual has been doing this for so long, like maybe even put a deadline, like 10 years, and after that, they won't have to do their renewal, like a time frame to, if they've been doing it for so long, 30 years is a long time, and having to come every year to get renewed, maybe about 10 years, and after that, they don't have to come and renew all the time after they meet a certain goal or time. Are you amenable to that?
I honestly would never have thought about that. I guess the only risk that's still posed, regardless of the actual health certificate, is the education part. Is that when we do our refresher courses, we kind of give these hot button issues that have come out as a result of the recent inspections and things to note as extra sort of pay attention to this sort of thing. But I suppose at this point we could consider that, but I guess we'd have to establish it, and so we'd have to amend our rules and regulations to do so.
Okay, because I see it's been done like with realtors, getting continued education, insurance, individuals who have insurance license, after a certain amount of years, they don't need that continuing education. Thank you, Madam Chair.
Thank you, Senator, and thank you again to the Department of Public Health for your testimony and to all those others who's testified here today. The committee will consider bill number 77-37 LS duly heard. We will move to the next agenda item. This is bill number 92-37 COR, introduced by myself, Therese Terlaje. This is pursuant to the AAA Administrative Adjudication of Rules process. It's an act to add a new Article 9 to Division 1, Chapter 4 of Title 26 Guam Administrative Rules and Regs relative to the adoption of rules and regulations governing barber and beauty shops, cosmetology schools, and nail salons. Attached hereto is Exhibit A. So as a sponsor, I'm going to introduce the bill very briefly. These proposed rules and regulations for the governing of barber and beauty shops, cosmetology schools, and nail salons was submitted by the Department of Public Health and Social Services to the legislature pursuant to the Administrative Adjudication Law on March 27, 2023. Also pursuant to the Administrative Adjudication Law, the proposed rules and regulations were reviewed by the Office of the Attorney General, and they were approved by the Governor of Guam as to policy. Chapter 21, Title 10 of the Guam Code Annotated mandates the Department to regulate the sanitary operations of cosmetic establishments. Section 20105 authorizes the Director of Public Health to adopt and promulgate rules and regulations as necessary to carry out the provisions of the mandate. The Division of Environmental Health held a public hearing to receive comments from the community on August 30th. This is all pursuant to the AAA process, and according to Public Health, 28 members of the public attended the hearing. 5 gave oral testimony and 0 gave written. As part of the Administrative Adjudication Law, the Division of Environmental Health conducted a preliminary survey and anticipates that the economic impact of the proposed rules and regulations would be less than $500,000. Thus, an economic impact statement will not be required pursuant to Section 9301I of Chapter 9, Title 5, Guam Code Annotated. The bill was introduced on April 7th and referred to the Committee on Health on April 10th, 2023. So we've specifically requested feedback on this bill from the Guam Board of Barbering and Cosmetology, who promised to send it to all of their members, and the Guam Community College School of Cosmetology. We'll now receive testimony, and there are several people signed up, so I'm going to read them in the order. Of course, we'll have Public Health first, and thank you for sitting at the table. And I'll call the others right after Public Health, all right? And so, Senators, if we would hold our questions until all of the testimony. Well, actually, hold on. I have the Jenneth Kimball and Ashley Taitano-Sablon to give oral testimony. All the others who've signed up say they are in support. There are about 12 of you signed up in support, but not to give oral testimony. Is that correct? Does anyone else want to give oral testimony today? All right. Okay, so we'll proceed. BBMR gave a detailed fiscal note as to the proposed changes and the financial impact to the different categories of training, protective clothing, food consumption, ventilation, and coming into compliance. And they estimated $394,515 would be the economic impact. All right, so this, okay, we'll proceed with Public Health. Please, Acting Director, introduce your team.
Hi, I'm Charlene Siniclis. I'm the Acting Director for the Department of Public Health and Social Services, and providing testimony on Bill 92-37. With us, we have Mr. Veneer Raimundo, who will be going ahead and reading the testimonial submitted by your Director, Art San Augustine, and also with me present is Acting Environmental Health Chief Francine Salas, for the record.
Please proceed, Mr. Raimundo.
Hafaday, good morning. Hafaday, Madam Speaker Therese Terlaje, and the members of the 37th Guam Legislature. I am Arthur U. San Augustine, the Director of the Department of Public Health and Social Services. Thank you for allowing me the opportunity to present testimony on Bill 92-37 COR, an act to add a new Article 9 to Division 1, Chapter 4 of Title 26, Guam Administrative Rules and Regulations, relative to the adoption of rules and regulations governing barber and beauty shops, cosmetology schools, and nail salons, attached hereto as Exhibit 4. Section 21102, Chapter 21, Title 10 of the Guam Code Annotated, or GCA, mandates public health to develop rules and regulations for the sanitary operation of cosmetic establishments as defined in Chapter 27 of the same code, the current rules and regulations pertaining to barber and beauty shops, schools, and the practice of barbering and cosmetology, or regulations, was adopted in 1984. The Division of Environmental Health, or DEH, of Public Health determined that some provisions in the existing regulations need to be expanded upon and further clarified to protect the health and safety of customers and employees of Guam's cosmetic establishments. As of April 14, 2023, there are a total of 121 barber and beauty shops and 3 cosmetology schools regulated by DEH. If adopted, the proposed regulations will govern the operation of these 124 cosmetic facilities and impact the health and safety of their customers and employees. In the development of the proposed regulations, DEH met with 20 stakeholders on October 15, 2021, and October 22, 2021 as well, seeking clarification and comments on the proposed regulations. The proposed regulations were subsequently revised after these meetings and considerations of stakeholder comments. In compliance with the Administrative Education Law, 5 GCA, Chapter 9, Article 3, Public Health adhered to the required procedures promulgation of these proposed regulations by performing a cost impact assessment and conducting a public hearing. In 2019, DEH conducted a preliminary survey of cosmetic establishments to determine the economic impact of adopting the proposed regulations. A survey questionnaire was distributed to all 110 establishments from March 9 to 12, 2019, with 52 responses, or 47% received. DEH conducted a sample survey as not every establishment responded to the questionnaire. Based on stakeholder responses, DEH determined that the annual economic impact of the existing requirements and the new provisions in the proposed regulations would be less than $500,000. Thus, an economic impact statement was not required pursuant to Section 9301, subsection I, Chapter 9 of Title 5 GCA. Administrative public hearing to receive public comments on the proposed regulations was held on Tuesday, August 30, 2022. The announcements were printed in the Pacific Daily News on August 16, 2022, and August 29, 2022. Copies of the proposed regulations were also made available at the Division of Environmental Health Office and on the department's website. Some of the most significant changes in the proposed regulations include updating the ventilation parameters to reduce volatile organic compound levels, expanding the list of allowable single-use items, limiting the consumption of food and drinks in the establishment, establishing a physical separation of space to prevent cross-contamination, posting of signs to prevent the transmission of infectious diseases, defining prohibited services and chemicals, outlining requirements for sanitation and laundering processes, and clarifying requirements for sinks. The department acknowledges that some of these requirements may take time and money to complete. To assist the industry in making changes to their establishments and operations, language was inserted into the proposed regulations to provide existing cosmetic establishments with 3 years from the date of adoption to fully comply with the proposed regulations. In the interim, existing cosmetic establishment must still adhere to the existing regulations for cosmetic establishments until the 3-year effective date is in place. However, newly built, renovated, or open establishments must comply with these proposed regulations should they pass for adoption as the new cosmetic regulations. Cosmetic establishments provide a wide range of services, including hair care, hand and foot care, hair removal by waxing, and many other new services that have come out over the past 4 decades. However, there are health concerns associated with these services. These health risks vary depending on the products and tools used, the nature of the business tool used, the nature of the business operations, and the hygienic practices of the customers and employees. Diseases such as hepatitis B and C, herpes, AIDS, skin and eye infection, hair lice, and chronic fungal diseases may be transmitted in such establishments. As mentioned earlier, the current regulations were adopted in 1984. That was almost 40 years ago. There are new treatments, procedures, and equipment that are not covered in the current regulations, which is why it is necessary to adopt the proposed regulations to ensure that cosmetic establishments continue to provide services while utilizing the safest tools and methods. Employees are following proper hygienic and sanitation techniques, health risks are prevented or minimized for customers and employees, and public health regulations are up to date in regulating the sanitary operations of such establishments in Guam. Thus, Public Health supports the passage of Bill 92-37 and urged the members of the 37th Guam legislature to do the same. Thank you once again for allowing the department to provide its testimony on Bill 92-37, Sizuos Masi. Arthur San Agustin.
Sizuos Masi. Would anyone else from Public Health like to testify in addition? All right, if not, Jenith Kiemba,
Good morning.
Good morning.
Good morning. Thank you all so much. I just want to say, just like how Senator Chris was just acknowledging, thanking everyone. Just want to thank you all, senators, for just being here and doing the great job that you guys do. I don't think you guys hear it much, so we just want to thank you. We're just here. I'm Jenith Kimbao. I'm the board chair for the Guam Board of Barbering and Cosmetology, and we're just here in support of the bill. We just want to thank the Department of Public Health for doing their due diligence in making the necessary changes. We appreciate all the job that they've done to make that possible, because we did have those meetings with them, and they were able to do all that we asked them to do in order to make those changes. So we're here just to support. Thank you.
Thank you. And with you is Ashley Taitano Sablan, the Vice Chairperson of the Guam Board of Barbering and Cosmetology. Would you like to testify?
Yes. Good morning. Thank you, senators, and thank you, Public Health, too, for putting this bill together, putting the rules and regulations together. We do appreciate that. There has been a need for an updated rules and regulations, especially when it comes to sanitation, public health, safety, and infection control. So we appreciate that. And yes, we are in support of this bill. Thank you.
Thank you. I'd like to also acknowledge GCC School of Cosmetology. There are several of you who are here today. Thank you for being present and for this hearing. Somebody said there's a lot of good hair in the room, one of my colleagues. Not up here. But Sizuos Masi again for being here. So, all right, so we've got the Board of Cosmetology and Barbering in support of the bill, and we've got Public Health stating the reasons for the bill. There's also a testimony that's been submitted in writing from Daniel Gurwell. Buenas and half a day. The following are my credentials and accomplishments related to the field of cosmetology. Graduate from GCC Cosmetology Program, GPA 4.0. Licensed cosmetologist, 25 plus years. Licensed cosmetology instructor, 15 plus years. Instructor for 20. Certified Milady Master Educator. Certified Milady Advanced Master Educator. Wella Professional Master Color Expert. Certified Master of Balayage. President and founder of the Guam Barber Cosmetology and Massage Therapy Association, co-owner, educational director, and lead instructor of Stay Fresh Academy. I taught at both GCC and Mariasi Beauty Academy. I have concerns regarding Bill 92, and then there's a title. Firstly, the amendment is not a set of rules and regulations governing the above list of professionals. This is simply a document with sanitation guidelines. It is mistitled. I encourage this bill not to be passed as is, and for the Guam Board of Barbering and Cosmetology to continue to work on actual regulations that will help organize and regulate the industry. There are many topics that will continue to be improperly addressed. An example of this would be the process of accreditation for a new cosmetology school. When a school has been open for 18 months, an application can be submitted to NACCAS for processing. Before applying, an owner must go to a workshop on the mainland. Upon completion of the workshop, the school can then set up an account and begin the submission of pertinent documents. Once all documents are approved, a team will be scheduled to come to Guam to inspect the school. Upon approval of the aforementioned, then accreditation will be granted. The total cost of accreditation is roughly $17,000. Secondly, according to the law, a board member can only serve 2 consecutive terms. The second major issue is clarifying the legitimacy of the current chair to continue the board if said member has violated the above statute. The chair's own testimony, she's been on the board for at least 9 years. I represent the voices of all of our association members as well as many that have voiced their concerns and want to be heard. So as to the board terms, I think that's not necessarily the subject of this bill. However, we will take a look at that. And the accreditation of schools for cosmetology, I know this was the subject of another bill in the past term that had a public hearing and received kind of differing testimonies, but that is not the subject of this current bill. So we would have to address that in a different hearing. However, as to these set of rules, being sanitation guidelines, does public health have any comment on that? Again, so you talked about ventilation, and maybe just summarize again the parts of an establishment, that the requirements that are being affected by these rules and regs.
Hi. So one of the new things from the previous regulations that we're updating is regarding the ventilation. So for example, nail salons currently, we don't require them to have ventilations. The current regulations, we're now requiring them, if passed, to have ventilations to get rid of what we call, or reduce volatile organic compounds, or VOCs, which can be bad to the staff and the customers. And in addition to that, regarding sanitation, it's more specific to what type of sanitizers to use, and especially chemicals that are approved by EPA.
And where do those chemicals come into play?
So for example, like sanitizing equipment, that's when it would come into play regarding sanitizing their equipment. Also other chemicals that they would use in the establishment, like for example, for the hair, for the nails as well.
In addition to ventilation, are there other requirements being imposed by these rules and regs?
In addition to that, expanding the list of allowable single-use items, like for example, what do you call this?
Disposable?
The disposable, like the nail files, the clips. In addition to that, limiting the consumption of food and drinks in the establishment, and posting signage as far as preventing the transmission of infectious diseases. Like for example, also in nail salons, for if they were to conduct services for the feet, they should have signage to prevent, if it's stating if you have any open cuts or diseases, then they shouldn't get their services done.
Okay, thank you. And so for current establishments, they've got 3 years to comply with the ventilation requirements. There was some concern at the public hearing that was held by Public Health as to the cost of retrofitting an existing establishment. Would portable ventilation, is there such a thing, would that be allowed?
It would be something that we'd need to look into, but regarding ventilation, there's a certain requirement as far as how much ventilation is needed, and it's measured in I believe CFM. I'll need to get back to you regarding what the unit means, But as far as portable, it's something that we can take a look into, and then we can get back to you on that.
All right, and if a person does not comply with, or an establishment does not comply with these new rules, what happens?
Then they will be cited. If it's passed and they don't comply, then they would be cited for sanitation-wise. And of course, if they get more than 40 demerits, then it would be suspension of the permit, or suspension of the permit.
All right, so it's citable and it's also part of the accumulation of demerits
Yes.
in an inspection. All right. All right, I'd like to note that, Mr. Gura, I read your testimony and that you're here today. Thank you for being here. I read your testimony earlier. Sure, please. Press the microphone.
I guess you had to read lips. Buenas and Hafade. I would like to clarify that I actually do support the bill, and I'm so pleased that you guys put in the air purifying. That was one of the issues that I actually brought up before, because I.
Could you say that again in the microphone?
So I appreciate to see the fact that the air purifier, the contaminants, et cetera, was put into this bill, because that's something that was a major concern of not only myself, but I think many that I spoke with. And so I'm really excited to see that implemented, because at the end of the day, the safety of our clients as well as our workers. This will really impact the nail salons, which is at the highest risk of health factors in our industry. I do mostly hair. I haven't done nails in a lot of years, although we're all qualified to do that. But my main concern was pregnant women, lactating, et cetera, and then just the nail workers, because the impact of these toxins over time, it builds up and is very detrimental. So I'm really excited to see that in there. My only point of concern is that this bill is specifically for health, and I think it should be clarified that that is such. This is not rules and regulations for cosmetology, for operating and setting up how we would deal with specific situations. It's specifically to the health concern, to the Department of Health. And that would be my only request, is that it be clarified that it's specifically for that, because I know the board is still working on rules and regs to govern our industry. And again, as many hats that I wear, we've always been in support of that process going forward, and would step in to help if ever asked. So, thank you.
Thank you very much, Mr. Gura. Thank you again to all of you testifying, and I'll open it up to the panel. Senator Fisher, you're recognized.
No, thank you. I have no questions, Madam Chair.
Thank you so much, Senator. Senator Taitagui, you're recognized.
Thank you, Madam Chair. While I was reading your testimony for public health, how do you say your first name again?
My first name is Veneer.
Veneer?
Yes.
Okay. Veneer. So it says here in the interim, existing cosmetology establishments must adhere to the existing rule, regulation of cosmetic establishment until 3 years effective date is in place. So this means that if the bill should pass, right, then everyone is notified. All the establishments which you have mentioned, about 121 and 3 cosmetology schools will be notified once the bill passes, correct?
Yes.
And they'll have 3 years to comply.
Yes.
In the interim, what happens if there are certain regulations that are not, adhered to, that is causing a major health issue? What will public health do? Even though it's not in the rules, but it is technically in 3 years, but what happens then in the 3 years? Because there can be a lot of health hazards, like, Mark was mentioning earlier about, nail salons, and I've been in there, and it is like, whew, the smell is so bad. What will you do at Public Health? You'll continue to push
So
for this? Yeah.
within the 3 years, all of the establishments, they will still need to comply with the current rules and regulations. And when we do conduct sanitation inspections, if they are not in compliance with the current regulations, then they will be cited as well.
But you said it won't take effect for another 3 years.
We have a current rules and regulations for cosmetology, which was back in 1984, so that's what we're currently using right now.
Mhm. I remember the public hearing we had on this bill in 2019, and there was a lot of controversy. I remember you guys were at the table too as well, some issues that needed to be addressed, and needed to be addressed quickly. I'd hate for any of the establishments to be able in the next 3 years continue to do the status quo, which based on your actually sanitary compliance rather than rules and regs, that they're not being adhered to, especially if there's a health hazard. So it's just caution to public health to continue to go out there, and if you see these health violations, even though it's not in compliance for another 3 years, you've got to get them updated now and not wait, okay? So that's my concern. I don't want you guys to just slack for 3 years until it comes into play. It should be done now, okay? Appreciate that. I see that you do the demerit system. That was good. Do you agree, Public Health, with the comments made by Mr. Guwel? Is that I pronounce it right? Gurel? With regards to this is not basically rules and regulations, but more of a sanitary guideline.
Good morning, Senator.
Good morning.
I don't know if it was stated for the record. My name is Francine Salas. I'm the acting Chief Environmental Public Health Officer. Sorry, the question again?
So the question is that these are rules and regulations, or do you think they're more of sanitary guidelines, for the establishments for cosmetology, et cetera, down the line, than it is rules and regs? Because as he mentioned, that there are rules and regulations still being developed, yeah.
So the actual section that this touches upon, it's going to get included in the Guam Administrative Rules and Regulations, is in Title 26, which is basically public health section or title. So the article that is being added, which is Article 9, specifically deals with the sanitation. And so it may be a little off-putting in the title, but in no way does it give any guidance on how to set up a business establishment, what type of accreditation you need. Mostly we're dealing with the structure, and I think the updating since 1984 has defined what exactly is this type of establishment and what would be required in this type of establishment to operate, protecting everybody who works there, and then anybody who comes in, from customers to their guests. And so, yes, if the title, we would not be opposed to the title change at all, but I mean, also where it actually goes in statute or in administrative rules only touches on our section, not at all. We don't want to sort of overstep where we can.
Okay, thank you, Francine, for that. And it is going in the GAR, and I think even the rules and regs, once they are developed, will be placed in the same location as well. Just a little separation would help individuals researching to find out what's sanitary and what is guidelines. So I greatly appreciate. Now I understand why everyone is here today, and yeah, definitely well-groomed. Should have combed my hair, but I know we're all up here going like this, checking our FaceTime now. But I greatly appreciate the support in the room. This is amazing. You obviously care about your profession, and you want to make sure it's done fairly. And this is such a great sign and good to see. So thank you so much, Madam Chair, and thank you for everyone who's here.
Thank you, Senator. Senator Barnett.
Thank you, Madam Chair. Wow, 1984 was almost 40 years ago. Why did it take this long to update the rules and regs?
Hi, good morning,
Morning.
Senator Burnett, Madam Speaker Terlaje, Senator Fisher, Senator Dueñas, Senator Taitogui. So my name is Leilani Navarro. I'm an Environmental Public Health Officer Supervisor with the Division of Environmental Health. So I would say, to answer your question, Senator Burnett, it really boiled down to the staffing at DEH. As you know, for decades, we've been understaffed, and we just do the regulations. We have the strategic plan, so we have about 26 mandates, so about 26 regulations to update every now and then. And so with the other priorities, more pressing priorities that we have, so that's why it took this long.
Thank you.
You're welcome.
Are we taking care of everything we need to take care of in one shot, or are we going to have to come back in another 40 years?
Well, this is based on the current science that's available,
Right.
and it's patterned over with the requirements in other jurisdictions like Hawaii, California, Nevada. So hopefully we don't have to do this like in the near future yet.
Thank you, ma'am.
Yeah, and I just wanted to, if I may, address Speaker Terlaje's question about the portable ventilation system for nail salons. So we've studied, other jurisdictions' regulations. Some of them have the language that requires there has to be an adequate ventilation without any measurement, like how we have it in the existing regulations. It's very vague. It just says adequate ventilation. But some of the more progressive states, they actually require that it follows the International Building Code, which also refers to the International Mechanical Code. So these codes actually require that for each nail salon with a ventilation system, it has to be exhausted to the outside atmosphere for it to be effective. It cannot recirculate within the facility, which is what happens with a portable ventilation system.
Yeah. I wanted to ask about that specifically because kind of like what Senator Taitogui mentioned. For example, you go to the mall, you can smell the nail salon, from the food court. And so I was looking at your regulations here. Nail salons shall install downdraft ventilated nail tables, portable nail salon source capture ventilation systems, or an approved ventilation system that exhausts airborne contaminants to the outdoor atmosphere. Such ventilation systems must be capable of exhausting contaminants not less than 50 cubic feet per minute, or as is current to comply with the, like you mentioned, the International Building Code. So for example, I know in the States if you're building a nail salon, sometimes you're building it from the ground up so you can meet a lot of those requirements. But here on our island, right, where it's kind of take what you can get. And so for example, a nail salon that's located in a strip mall or a shopping mall, is it feasible for them to institute these ventilation practices, or is this something that they're just going to end up having to get a variance for?
Well, thank you for that question. That was actually brought up during the public hearing. And, we considered that. That's why we actually provided the 3-year phase for them to come into compliance. So that was Senator Taitagui's question. We actually took in consideration their comments that they needed time to comply with this big change. So, but in the meantime, while waiting for 3 years, they still have to comply with the existing regulations, which says that they have to provide adequate ventilation still, although it's vague, but it's still citable. So.
Does anyone know how toxic breathing that stuff is? Because I don't get my nails done often, but the few times I have it, man, you walk out of there lightheaded.
Can you testify as to the toxicity of that air, or what the concerns are?
I'm sorry, yes. We actually had an intern that worked for us and in coordination with EPA during the development of these rules and regulations. We I wasn't involved with it, but they had a machine that measured the VOCs in some of the nail salons or beauty shops in the island. And it was found that there's high, I can provide you the test results if you would like that, but it was shown that there's high VOC levels, and as some of you have mentioned, in the long term, these high VOC levels can be toxic to the body, they can be carcinogenic, they've been proven to be carcinogenic, so that will really endanger the lives of especially the workers who are daily exposed to these products.
So are you saying that the protections are adequate or not? The ones that are currently in place that the nail salons have to comply with?
I wouldn't be able to say because we have not gone in and really, it wasn't us, it was the intern and EPA who did it. And our regulations actually require 15 cubic feet per minute. So we have to measure if it meets that ventilation requirement for us to say if they meet it or not. But based on the test results of that field study, then it appears it's not. Okay.
Yes, ma'am?
Okay, so I'd like to address that question only because that was a concern that I had when we had the hearing. And I have been in the nail salon business for over 30 years. And so that was a real concern to me. Now, there are many changes in the field of our industry. Science is always changing. So there are different things that a nail salon or a beauty salon can do to lower these effects that, harm the community. And one of those things are in the chemicals that they use. So there are chemicals now that are lower in all those, the fumes and all that. And so that's one. Now, with the ventilation, I did mention that in that hearing that the concern for me was exactly what you said, Senator, is if they have a salon in the mall, how are they going to be able to take ventilation all the way outside? That would cost thousands of dollars. And, these salons, that's a whole lot of money for them. So that was our concern. And so our suggestion was that they can bring in these portable air filtration systems, which actually I have. And public health has come in and they've actually tested my air in the salon. And they have this little cute system that they go around and they test the air. And so they do have the capability of testing the salons to be able to see if the air is good. So it is possible, and we didn't mention that, and that's why we're here to support the bill, because they're doing their job, and they're doing it really well, so thank you.
So your hair passed the test? Oh, air, I thought she said hair,
air.
Sorry.
Yes, my air passed the test.
Thank you, thank you, ma'am. Thank you.
Thank you, Senator. Senator Dueñas, you're recognized.
Cijus Masi, Madam Chair, and it's just nice to see Ms. Kimball, Ms. Sablan, and all of the beautiful folks have come out today to support this bill and to attest to the workmanship that's been put in. 40 years ago, I was taking my high school senior photo, and I can attest that I had hair like many people out there. But now I'm starting to think it's the chemicals that did this to me. No, it's genetics. Wanted a point of levity, but thank you for everyone who's come out today. It really shows that the industry is policing itself, is united, and wanting to make sure these rules and regs are updated. And Mr. Gurwal, thank you for your testimony as well, acknowledging that this is in the health section of the code, and we'll continue to watch it through the process. But I think this is a good work product that's been put forward, and Cijus Masi for the work that's been done, Madam Chair.
Sitzus Masi, Senator Dueñas. We received a call, my office received a call from the compiler regarding the bill says to add a new Article 9. According to the compiler, there is an Article 9. We were unable to find it. Neither was our counsel able to find it. So we are going to work with her. We might have to retitle this bill in accordance with the testimony and in accordance with the compiler's further guidance as to article numbers. Thank you to all of you who've testified here today, and again, to all of you who are in attendance to hear these proceedings. All right. We're now going to consider, there being no further testimony, we'll consider Bill number 92-37 COR duly heard. Sitzus Masi todos. We're going to proceed with our agenda after this. We'll give a slight reset. Okay. All right, half a day. Before I proceed with the third agenda item, which is Bill number 93-37, please come in if you're here for that bill. However, I made a mistake earlier, and I want to apologize to Senator Parkinson. He had sent in a written opening statement on Bill number 77. I had a miscommunication with my office, and I did not read this statement. I didn't realize we had one, but this was sent in yesterday, and I'd like to read the opening statement of the sponsor on Bill number 77. Public Health is still here, so I'm glad they will be able to hear this, and we will also provide them with a copy. So, again, Bill number 77 was to extend the health certificates from 12 months to 36 months, 1 year to 3 years. And this is the opening statement of Senator Parkinson. Picture this. A waitress who has been working at the same restaurant for over 30 years is about to renew her health certificate. At this point, she has done it over 30 times, to continue to work at the same establishment. And every time she renews, she has to pass an exam. She has to pay for the certificate. She has to take time away from work to renew her health certificate. Bill 77 seeks to extend the validity of health certificates from 1 year to 3 years. An annual health certificate renewal for thousands of service employees every year creates an inconvenience and barrier to those seeking employment in industries that require one, most especially the food and beverage industry. Health certificates in Hawaii are valid for 30 years, as are health certificates in California. Renewing a health certificate yearly is a barrier to employment. Some people do not have the time to take away from work to renew it or have trouble arranging transportation because renewal is not available online. Driver's licenses are good for 3 to 5 years, and we don't expect you to pass a written exam every year. The same should be true for health certificates. Additionally, Guam had 124,110 working age residents in September 2021, and more than half were not employed. A total of 50,410 working-age civilian Guam residents said, quote, they did not want a job, unquote, when surveyed by the government of Guam in September 2021. Out of 54,190 residents who were not in the labor force at the time. That's 50,000 out of 54,000. With employment numbers low, it is absolutely vital that we do everything we can to remove barriers to employment. The easier it is for our people to get jobs, the more people will be employed in our local workforce and contribute to the island's economy. Additionally, after reviewing the fiscal note and hearing from stakeholders about this bill, I am open to amendments that strengthen the intent of this bill and make it revenue neutral. I'm open to amending the bill to increase the cost of a 3-year health certificate and be revenue neutral with the current cost of a 1-year health certificate. I'm also open to amending the bill to only include health certificates for food and beverage handling, which only requires a written test for renewal and not a PPD skin test for TB, which is required for tattoo, massage, and cosmetology health certificate renewals. Those health certificates which require a PPD skin test for TB for renewal should remain at 1 year. So again, this is the opening statement of Senator William Parkinson, who is the sponsor of Bill 77, and I failed to read that earlier. I didn't realize we had received this, so my fault. So please take that into consideration as well, and we will consult with Public Health as we complete the committee report on Bill number 77. All right, and thank you all for being here today. Welcome to the Guam Congress building. We're here for our third agenda item, which is Bill number 93-37 COR. It's a bill introduced by myself, Therese M. Terlaje. This is pursuant to the administrative adjudication law, where the rules and regs come to us for final introduction as a bill and a public hearing. This is an act to add a new Article 26 to Division 1, Chapter 4 of Title 26, Guam Administrative Rules and Regulations, relative to adopting rules and regulations governing institutional playgrounds. Attached hereto is Exhibit A. As a sponsor, I will give a brief introduction of the bill. The proposed rules and regulations for governing institutional playgrounds were submitted by the Department of Public Health and Social Services to the legislature pursuant to the administrative adjudication law. Pursuant to that law, the proposed rules and regs were also reviewed by the Office of the Attorney General and approved by the Governor of Guam as to policy. The rules and regulations are intended to provide standards for playground equipment to protect the health and safety of Guam's children who attend child care facilities and schools. The Division of Environmental Health of the Department held a public hearing to receive comments on April 22, 2019. According to the division, there were 26 members of the public in attendance. 4 gave oral testimony and 1 gave written testimony. The Division of Environmental Health conducted a sample survey and anticipates that the economic impact of the proposed rules and regulations would be approximately $916,000 in the first 2 years of its implementation. According to the Division of Environmental Health, this amount includes the estimated cost of complying with existing provisions and new requirements in the proposed regulations. After the 2019 public hearing, the proposed rules and regulations to my reading, were not amended. So they are in their original form. However, stakeholders did express their concerns during that 2019 public hearing, making it clear that they desired amendments to accommodate some of their concerns. During the hearing, several active daycares expressed their use of Little Tykes play equipment, which is not considered commercial-grade playground equipment, according to the rules. And if daycare operators remove their Little Tykes equipment to establish open play areas, it is unclear if they will still need a permit. In the same hearing, a recommendation was made to include a new section in the rules and regs to exempt the child care facilities without child playground equipment from obtaining a permit. A request was also made in that hearing for public health staff to provide guidance and suggestions to child care providers on how to comply with the rules and regulations before the 730-day period after the adoption of the new rules. Additionally, some daycare providers expressed frustration about having to acquire 2 separate permits, one for the daycare itself and another for their playground. There were other concerns regarding Joshua Singleton of Guam Leadership Academy, is that you, sir? Expressed that those regulations would lead to daycare operators increasing tuition rates to purchase playground equipment, and that parents are particular about daycare costs, and even a small increase in tuition could cause them to switch to another daycare. Several participants also voiced frustration over the requirement of obtaining the 2 separate, I said that already, sorry, and one expressed a concern that the regulation of commercial-grade playground equipment would lead to centers removing their playgrounds due to high costs associated with purchasing and shipping such equipment, and instead setting up open play areas. And lastly, some facilities also lack yard space to accommodate a commercial playground. This bill was introduced on April 7th, pursuant to the AAA process. It was referred to the Committee on Health on April 10th. We sent a request for feedback from the acting superintendent of Guam Department of Education, the CEO of Guahan Academy, principal of Guahan Academy, ABC Children's Center, ABC Southern Preschool, Adventures in Learning Child Development Center, Guam Leadership Academy, Little Garden, World of Wonder, Tender Shepherd, Mercy Heights Catholic Nursery and Kindergarten, Infant of Prague Catholic Nursery and Kindergarten, Dominican Child Development Center, Tamuning Daycare and Learning Center, Bureau of Social Services Administration at the Department of Public Health, P&G Child Care and Learning Center, Tina's Learning Center, Early Childhood Development, the Division of Environmental Health, of course, Cedars, which is at UOG, Harmony Kids, and Little Einsteins. And of course, to the public. We'll now receive testimony. I'd like to again acknowledge the presence of Senators Fisher, Senator Taitzagui, Senator Barnett, and Senator Duenas. Thank you, Senators, for being here. We also received written testimony on the bill from Edward Chang from Amazing Kids Child Development Center. All right, we'll now hear from those here to testify. Acting Director of the Department of Public Health and Social Services, you are recognized. And everyone testifying, please state your name for the record. Thank you.
For the record, I am Charlene St-Nicholas. I'm the Acting Director for the Department of Public Health and Social Services. We do have written testimony on Bill 93-37. And we'll have members of our team state who they are. We will be having Ms. Leilani Navarro go ahead to read out the written testimonial that's prepared.
Please proceed. Or, sorry, go ahead, please.
Good morning, Senators. My name is Francine Salas. I'm the Acting Chief Environmental Public Health Officer for the Division of Environmental Health. I'm here representing our division, in addition to Ms. Leilani Navarro, who will be testifying on the bill. And hopefully I can answer any questions that may be left over.
Thank you. Ms. Navarro.
Good morning, Madam Speaker, Terlaje, Senator Fisher, Senator Duenas, Senator Barnett, and Senator Taitzagui. My name is Leilani Navarro. I'm an Environmental Public Health Officer, Supervisor with the Division of Environmental Health. And as our Acting Director, Charlene St-Nicholas, have said, I will be reading our Director's written testimony on Bill 93-37 COR, which he signed April 17, 2023. So his statement goes, half a day, Madam Speaker,
I'm sorry, Ms. Navarro, can I just interrupt you for a minute? Do we have public health testimony copied? Did we make copies of that?
I was told you guys have a copy already. It was emailed
get copies
to your
for the
office.
Senators, please. All right. Thank you. I'm so sorry. Please proceed. Please proceed.
All right. So, half a day, Madam Speaker, Therese Terlaje, and members of the 37th Guam Legislature. I am Arthur U. San Agustin, the Director of the Department of Public Health and Social Services, or DPHSS. Thank you for allowing me the opportunity to present testimony on Bill 93-37 COR, an act to add a new Article 26 to Division 1, Chapter 4 of Title 26, Guam Administrative Rules and Regulations relative to adopting rules and regulations governing institutional playgrounds, attached hereto as Exhibit A. Section 1108.1 of Public Law Number 31-73, also known as the Rules and Regulations Governing Childcare Facilities and Group Childcare Homes, mandates the DPHSS to develop rules and regulations for institutional playgrounds. These rules and regulations are intended to provide standards for playgrounds and playground equipment to protect the health and safety of Guam's children who attend institutional facilities. Section 25-101 of Chapter 25, Title 10, Guam Code Annotated, defines institutional facilities to include schools, family daycare homes, foster family homes, group daycare homes, residential treatment facilities, daycare centers, day nurseries, nursery schools, kindergarten schools, daycare homes, or similar institutions or units. As of April 17, 2023, there are a total of 59 childcare centers and 45 elementary schools regulated by the Division of Environmental Health, or DEH. A playground is not a childcare facility or elementary school requirement. However, these proposed rules and regulations governing institutional playgrounds, which will be called the regulations from this testimony on, will guide childcare providers and school operators to make informed decisions relative to playground equipment in order to prevent or minimize injuries or falls at their facilities. According to our Bureau of Child Care Services, of the 59 licensed child care facilities, 4 facilities have existing playgrounds. If adopted, the proposed regulations will govern the operation of these institutional playgrounds, including the ones in elementary schools, and affect the nearly 20,000 children who use institutional playgrounds on island. To ensure that each piece of playground equipment is age-appropriate, durable, and comply with the standards of the U.S. Consumer Product Safety Commission, or CPSC, and the Americans with Disabilities Act, or ADA, the proposed regulations, which mirror the CPSC's Handbook for Public Playground Safety, were developed as mandated by Public Law Number 31-73. The Handbook for Public Playground Safety is a guidance document that focuses on the prevention of playground-related injuries and mechanical mechanisms of injury, because CPSC has determined that falls from playground equipment have remained the largest single hazard pattern associated with playground use. DPHSS adhered to the procedures outlined in the Administrative Adjudication Law, or Title V, Chapter 9, Guam Code Annotated, in the promulgation of these proposed regulations. On April 25, 2019, 36 stakeholders from childcare facilities and schools attended a meeting to discuss the proposed regulations. The proposed regulations were posted on the Department of Public Health and Social Services website on August 9, 2019. 10 copies of the proposed regulations and the economic impact statement were made available to the public at the Division of Environmental Health Office. An administrative public hearing to receive comments on the proposed regulations was held on April 22, 2019. The announcements were printed in the Guam Daily Post on August 8, 2019 and August 21, 2019. 26 members of the public attended the hearing, and 4 oral testimonies and 1 written testimony were received at that time. No written testimony was received after the public hearing. A survey questionnaire was distributed to 81 establishments permitted by DPHSS in fiscal year 2016 to determine the economic impact the adoption of the proposed regulations may have on the affected institutions. 54 responses, or 67% of the total survey questionnaires distributed, were received. DEH conducted a sample survey, as not every institution responded to the questionnaire. As a result of a sample survey, DPHSS anticipates that the economic impact of the proposed regulations would be approximately $916,000 in the first 2 years of its implementation. This amount includes the estimated cost of complying with the existing provisions and new requirements in the regulations. With the proposed regulations, DEH is seeking to issue institutional playground permits to all qualifying institutional facilities with playgrounds and equipment for use by children ages 6 months through 12 years. Institutional playground permits will be required for all new and existing playgrounds to ensure compliance with the requirements of the regulations. Some of the most significant requirements in the proposed regulations are age separation, signage and/or labeling, surface materials, and equipment compliance. The proposed regulations also detail the manner in which compliance inspections by DEH will be conducted, and the regulations will take effect immediately upon adoption. However, existing childcare facilities and schools will have 730 calendar days from the date of adoption to fully comply. According to the U.S. Centers for Disease Control and Prevention, more than 200,000 preschool and elementary children are treated for playground-related injuries at emergency departments each year, and 75% of these injuries occur at institutional playgrounds. About 45% of playground-related injuries are severe, resulting in fractures, concussions, dislocations, and amputations. Many of the hazards associated with playground injuries are addressed in the proposed regulations. For example, by limiting the height of equipment and providing adequate fall zones and protective surfaces, as provided in the proposed regulations, many injuries and deaths caused by falls would not occur or would be less severe. In addition, the effect of playground safety regulations in decreasing injury rates has been evaluated in a study done in North Carolina. The researchers noted a 22% decline in the annual rate of reported medically attended injuries in regulated childcare facilities over 3 years. This decline was associated with a decrease in observed hazards on childcare playgrounds. With the adoption of the proposed regulations, DPHSS seeks to prevent and reduce the number of playground-related injuries on island. Thus, our department supports the passage of Bill 93-37 and urge the members of the 37th Guam Legislature to do the same. Thank you once again for allowing this department to provide its testimony on Bill 93-37. Si Juas Maasi, Arthur U. San Agustin.
Thank you very much, Ms. Navarro, for reading the director's testimony, and thank you to the others in public health for being here. All right, we'll now proceed. I know that GDOE is also here. I'll go in the order signed up. We've got Mr. Joshua Singleton and Vanessa Singleton. Joshua, please proceed.
Hello, Joshua Singleton with Guam Leadership Academy. I'd like to thank all the senators for being here and letting us have speak. As child care providers and parents ourselves, we understand the need for safety and health of our island's children, and not only for child care facilities, right? This bill, Bill 9337, in my opinion, is very much geared towards child care centers. It states it's for all institutional playgrounds. However, it's evident during the supervision, under the supervision requirements, that it uses the exact same supervision requirements as that's in the early childhood guidelines and rules and regulations for child care. This is good, that's fine. However, when you go to the public schools, you don't see one teacher for 20 children for elementary kids out on those playgrounds. So in my opinion, there should be something added to these if you're going to require supervision guidelines in here that mirror other rules and regulations. There should be some sort of guidelines for being on the playground. I mean, we all drive by the public schools and see 50 kids playing on the playground and one teacher's aide out there watching them all. So that, to me, is an issue in itself. But I digress. Let's concentrate on the playground. We can talk about public school stuff. I personally feel that Bill 9337 is substantially better than the previous version discussed in 2019. However, there are 3 areas that I'd like to discuss. Number 1 is the existing facilities. We get 2 years, 730 days to come into compliance. But what does fully compliant mean to get into that time? Will we be required to obtain a provisional permit in the time once this bill is acted? That just basically says, hey, you got a provisional permit to be able to use your playground, because in the other areas it says if you operate the playground and don't have your permit, now you're eligible to be fined, right? So do we have to get a provisional permit? And when we do that, it simply should just state the things that we need to do to come into compliance, right? The second one is just more of a confirmation maybe for DPHSS or whoever is on page 16, lines 14 and 15, it basically states concrete, asphalt, or other hard surfaces shall never be used directly under playground equipment. The paragraph previous to that states that activity walls and playhouses and stuff on ground level are basically exempt from surfacing material. So I just want clarification on if asphalt play areas are still going to be allowed, because especially with school-age children, elementary age, or even older toddlers, preschoolers, they do chalk time and stuff where you let them play with sideway chalk and stuff on those areas, right? And so if clarification on that would be good, because in one paragraph it says you can't have asphalt at all, and then in another area it says that surfacing material is not required for specific types, right? And then the last thing that I had was on page 7, it also states that making additions or movements or major alterations to playground or equipment must submit plans to the director. Well, what defines major alteration for one? And does adding a new ground level playhouse or activity wall that's on ground level constitute as a major change? From my personal experience, we have playgrounds and, or not playground, playhouses that we move on a regular basis so the grass doesn't die in a particular area, so you don't get insect buildup underneath the playground, underneath the houses and things like that. Are we required to submit a plan change every time we want to move houses around our playground? It doesn't make sense to me for that. So in conclusion, I'd like to say I do appreciate this bill, and it is a lot better, like I said, than the 2019 version, and I do support the enactment of playground rules and regulations. So thank you for your time.
Thank you, Mr. Singleton. Could Public Health just clarify? So I had said earlier that these were not amended since the 2019 hearing. Could you please clarify?
That's correct, Madam Speaker.
All right, so you had a meeting prior to the public hearing?
Yes,
And-
that's the time that they made some changes.
Okay.
The stakeholders meeting.
All right, so there was a meeting in 2019 with 36 stakeholders, and then before you had your public hearing, that's when they were amended, and now we're seeing that amended version. Is that right?
So the stakeholders meeting was conducted April 25th, 2019, and there were some changes that were made. And then the draft regulations were finalized July 24th, 2019, and then the administrative public hearing was August 22nd, 2019.
All right, thank you so much. All right. Sir, you may proceed.
Good morning, Speaker Terlaje, Senator Duenas, Senator Fisher, Senator Tideway. Thank you for this opportunity. My name is Edward Chang. My wife and I own 2 child care centers, Inigo and Jigo. Our first center opened in 2005, and our second center is now awaiting the licensing from DPHSS for opening. As the name implies, child care is about the care, safety, and health of the children, which are the foundation of our business. As such, I fully support the adoption of this bill. This bill provides for and ensures uniformity in playground safety standards for all child care centers. I do, however, wish to share a concern regarding one statement in the bill. Section 1, lines 10 to 13 state that in 2019, and I quote, "The Division of Environmental Health conducted a sample survey and anticipates that the economic impact of the proposed rules and regulations would be approximately $916,000 in the first 2 years of its implementation." Madam Speaker, I can assure you that this cost for all institutions to comply with this bill will far exceed the DPHSS projection. To illustrate my point, our GIGO Center has 2,000 square foot in playground space with a concrete base that requires the entire playground to be tiled. To comply with the new regulations, I've received estimates for the appropriate safety tiles and ocean freight to Guam. Here is a summary of the cost. Tiles, glue, inland freight, $26,343.28. Ocean freight and final delivery to destination, $3,936. Total, $30,243.64. Again, this is only for the surfacing of one playground. This does not include the excise tax and the cost of installation. Our Anigua Center is considerably smaller at 1,200 square feet, but I still anticipate the cost of materials and shipping to be about $25,000. Again, these costs are strictly for the surfacing of the playground and do not include additional equipment or other materials to comply with the new regulations. Madam Speaker, as you and the honorable members of the Committee on Health, Land, Justice, and Culture discuss this bill, I humbly ask that you also consider adequate funding to assist the child care centers in complying with the regulations. The $916,000 in anticipated economic impact projected by DPHSS in 2019 is clearly well short of the real-world costs for compliance. To be fair to all institutions, I recommend a grant based on a fixed amount per square foot of playground space. For example, a grant such as $15 per square foot. A grant commensurate with the playground size provides parity for all. Whilst we certainly can't expect the government to shoulder all costs for compliance, I believe such a grant would undoubtedly help in setting us in the right direction. Thank you again, Madam Speaker, for this opportunity.
Thank you very much, Mr. Chang, and thank you for providing attachments showing the details of your testimony as well. I very much appreciate that, those estimates.
Thank you.
All right, we'll now hear from DOE. Mr. Sanchez?
Good morning, thank you. Good morning, Madam Speaker, Senator Duenas, Senator Fisher, and Senator Tyree. My name is Joe Sanchez. I am the Deputy Superintendent of Curriculum and Instructional Improvement for the Guam Department of Education. I was tasked by the Acting Superintendent of Education to review Bill number 93-37 and to compile and present testimony from the DOE. I have with me today Mr. Phil Tovis, GDOE Facilities Manager, and Mr. Ed Brown, GDOE Safety Administrator, who may also be able to answer any questions that you have for the DOE. I will be providing our overall testimony, which includes input from all elementary schools, the Head Start program, and the GDOE management team. Thank you for this opportunity. Though I am a secondary trained educator, my time as a Deputy Superintendent of Curriculum for all pre-K-12 public schools has given me the opportunity to see firsthand the importance of a safe and functional playground. Opportunities to play is essential for a child's growth and development, and outdoor play is an integral part of their physical and mental well-being. This is why playgrounds are a vital part of elementary school education. They provide a place for children to play, exercise, socialize, and develop essential skills like balance, coordination, and teamwork. Unfortunately, however, playgrounds can also be dangerous, and accidents can happen if safety measures are not in place. Every year, thousands of children throughout the country are injured on playgrounds, and many of these injuries are preventable had the proper safety measures been in place, as they noted earlier. Additionally, playgrounds can also pose significant risks to children's safety, especially when equipment is outdated, damaged, or not properly maintained. This is why we are in support of the Bill 93-37 and its intent, as we believe it is crucial to update playground safety regulations to ensure that all of our children are safe while playing. Safety regulations must be based on the latest research and standards and must be enforced consistently to ensure that our children are not put in harm's way. With that said, we must all recognize that updating playground safety regulations can be expensive and funding difficult to come by, most especially with all the facilities issues we face today in our schools. Even with the substantial funding provided through the American Rescue Plan, which amounts to a little over $120 million earmarked for capital improvement projects, and the additional funds recently provided to the GDOE by the Guam legislature, we are unsure that we are unable to fund all of the upgrades needed to bring our schools in compliance with the proposed standards and regulations. Without proper funding, schools may have to compromise on many safety measures, ultimately making us non-compliant, but more importantly, which can put our students at risk. We must ensure that schools have the resources they need to keep children safe while they learn and play. Additionally, we are concerned that even if additional funding were to be provided, or if the costs were found to be affordable within our current resources, we may not be able to complete the needed upgrades to all schools within the prescribed 730 days, considering the numerous capital improvement projects scheduled to take place over the next 18 months. For example, one principal noted that based on a quick review of the provided checklist and an assessment of his playground, they will need to remove all playground equipment because they will not meet the safety requirements, purchase and install equipment to accommodate 650 students from ages 4 to 12, install fall protection under all equipment, install shade protection, install fencing and barriers to separate students, and grade and slope the playground to ensure drainage and prevent standing water. Another principal noted that at her school, she operates 3 playgrounds. The Head Start playground might be the only one that's compliant with these regulations, while the surfaces of the other playgrounds do not have the leveled surfacing and materials required. Thus, based on a quick survey of elementary schools after their review of the bill, we believe that all elementary schools, with the possible exception of the least schools, will not meet the standards in these new regulations, thus requiring the funding and time to upgrade their facilities. Regarding supervision, a major concern was the supervision requirement of 1 to 20, which is substantially lower than our current board policy of 1 to 150. A change like this in the ratio will require substantially more staff beyond what is currently available. Please note that Head Start, which services children ages 3 to 5-year-olds, already has a ratio that has to be maintained at 1 to 10, even in outdoor playing environments. In summary, I would like to reiterate our support of the bill and its intent with the following recommendations. Ensure that the schools have the funding needed to make the necessary upgrades to their playground facilities, with the possibility of delaying implementation of these regulations until funding is identified and provided and upgrade work completed. Provide for the possibility that schools may need more time to come into full compliance, even if funding is provided. This is a big concern as we are expecting a number of capital improvement projects to be taking place over the next 18 months, all concurrently. To address this, for example, we can allow the Director of Public Health to delay implementation for certain schools upon the submission and implementation of a construction plan with a reasonable timeline for completion. Lastly, we ask that the GDP ratio of 1 to 150 and 1 to 20 for pre-K be maintained. Head Start will maintain the required ratio of 1 to 10. Thank you for this opportunity to provide testimony on behalf of the Acting Superintendent and the Department of Education.
Thank you very much, Mr. Sanchez. Could Public Health just remind us again what the rules provide for these ratios?
Yes, Madam Speaker, it's actually, let me look at it. It's on page 14, table 2, lines 12 to 18. So for birth to 12 months, the ratio for child to staff ratio is 4 to 1. 13 months to 2 years is 6 to 1. 25 months to 3 years is 10 is to 1. 37 months to 4 years is 15 is to 1. And 4 years and up is 20 is to 1.
And the age of pre-K, Mr. Sanchez? 4 years and up. Thank you. Okay. So are you saying DOE is already in compliance with these ratios? I'm sorry, put that on the microphone if you don't mind, yeah.
For pre-K, yes.
For
but
pre-K and
we
Head
wouldn't-
Start.
And Head Start. We wouldn't be if it were to be 1 to 20 for 4-year-olds and
All
above.
ages
All
above
ages,
4.
yeah.
You're only in compliance for the 4-year-olds.
Yeah,
Okay.
our policy is 150.
Okay, got it. All right, so for all other elementary ages. Okay, thank you, I just wanted to clarify that. All right, we have others here to testify as well. Mr. Benson, are you?
Half a day. Thank you, Speaker Terlaje, Senator Taitigui, Senator Fisher, and Senator Duenas. Thank you for giving me the opportunity to testify. Some of you might not know who I am. My name is Benson Ao Young. I lived in Guam almost 50 years. God, time flies. And I went to Cathedral, went to Bishop, went to FD, and I graduated from UH Manoa. I'm here today to testify as a certified playground installer. And we've been installing playground for 12 years. So my main concern is the safety of the children. It's the most important thing, and I want to share some of my experience and some of the parts of the bills that I see that might need to be adjusted. I'm here to support Bill 93-37. It's a very responsible bill. It's long overdue, and as far as the safety, concern, because not all playground that's manufactured in the United States, even in the United States, and especially in some of the other countries, are compliant with the international play equipment standards. And so, if any of the playground does not meet the standards, our children are in danger, and even worse, we're breaking the law. While there's nothing wrong with all the language in this bill as far as the safety concern, I'm only talking about the safety, the rules and the safety part of the equipment. But through my training and experience, I feel that there are some items that are left out, and some of them it's not law compliance that is missing in this bill that is addressed. Basically, I believed, as this lady here mentioned, I believe the safety equipment came from the PPSH handbook, PPS handbook. Now, after reviewing some of the standards, the regulations on there, I see that it's probably came from an older version of the handbook. And I'll go over some of the things, and I don't want to dissect everything, but the reason why this handbook is updated regularly is because the industry, the manufacturer update the equipment every single year. They come up with new designs and new developments of equipment so that it provides the children and the parents to play together on the playground to provide better child development. So I'll point out a few things just to show that the regulations here, it's probably outdated. It's, for instance, on page 15, line 21, where it says the swing equipments are prohibited from having multiple occupancy on a swing, with the exception of a tire swing. Recently, there is a new design to provide parents and children to play together on a swing that is developed for playing together. I don't know if you can see it so far. Okay. But that's the reason why I think that is an outdated versions of the handbook, because I have the newer versions of the handbook over here, and the newer handbook's version says that multiple occupancy swing, with the exception of tire swing and swing that are intended for more than one user, are not recommended because of the greater mass. So it's okay if the design of the swing is designed for multiple person, like a tire or the ones in the pictures that I've showed you. Some of the other things is you talk about seesaw, miracle round, spring rockers, but there's definitely a lot more designs out there that that's not covered by the handbook. Also, it talk a lot about fall height, which is a very important part of the safety issues, but it never really actually tells you exactly what the fall height and the thickness of the tiles should be. For instance, if it's an 8-foot fall height, the tile should be 4 inches thick. If it's 6 feet fall height, it should be 3.5 inch thick, and so forth. Those are the information that really needs to be addressed. Also, I mentioned that it could be breaking a law. The law would be the ADA compliance law. Playground equipment needs to be compliant with ADA, just like every building that you build where you have ramps for the children to use their wheelchair up into the doors. The playground needs to have a parking space for a wheelchair and a transport platform so that the kids can get into the playground and play the same as every other children. Now, those are a lot. There's a lot more that that needs to be included in this bill. However, there's an easier way, I think, that we can solve this whole problem. As I did my training in the States, and I have been in the industry for 12 years, and I've seen what everybody does in the community, whether it's school or public parks or so forth. First, the institution should seek out a supplier who are qualified, who are the IPEMA approved. IPEMA stands for International Play Equipment Manufacturing Association. There's hundreds of them. So those people are already been approved by IPEMA that the equipment is already compliant with all of the standards in this book, new or old, or even as time goes on, this book will be updated. Even my book here is 2010. So I'm sure there's going to be a new one that's coming out fairly soon, and they will be already be compliant as far as that. And the liability will be addressed by the manufacturer themselves, because they're the one who built it and they study it and they follow the standard to a T. Second, the equipment should be installed by a certified installer, because you can have a compliance equipment, but if they install it incorrectly, if they have, like, let's say, a screw that it's too long and it's sticking out and snag on the kid's clothing or get cut or something like that, the safety issue is also notified, right? And lastly, what most people, government and schools, what they do is they hire, or they can have what they call a certified playground inspector, safety inspector, CPSI. That's a person who goes through several weeks of studies, and before they become a CPSI, they will have to pass an examination. The CPSI needs to renew the certification every 3 years because, rules and regulation changes. And therefore, a CPSI will be able to tell you exactly if the equipment is, following all the specs as far as the current standard regulation. They will be able to tell you if they have an equipment where they drop the ball onto the flooring to tell you that if the flooring meets the requirements of the fall heights. And they have all the equipments that be able to do that. Because even for myself, after reading the handbook, after reading, I'm sure, we cannot just get any employee according to the bill, an employee or representative from the department to be able to read this and understand every small detail of safety of the playground equipment compared to a certified playground safety inspector who has went through an examination and renew every 3 years to be able to make sure that a playground is safe. So in short, my concern is that, yes, we have the current handbook, but that's a handbook. If you make that into a law, that means you will never be able, well, you could change it, but it's moving mountain, right? It's just, you will have a difficult time of changing it. And from here on, whatever the new design, new features and technology that comes out of the playground will not be able to cover under the current playground equipment. So I think we don't want to reinvent the wheel, and the playground, certified playground safety inspector could be somebody from the government department that they can take the course and be certified, and they're the one who knows what the current safety issues are and be able to tell you if the equipment is safe or not. And that's my testimony. Thank you very much.
Thank you very much. Could you say the title of the guidelines that you were talking about? Public Playground Safety Handbook, and you're saying that's been updated since the version that you think Public Health is using. And the same title, though?
Well, seeing that it's almost mirror the bill, but there are a few things that's different. So.
And what's the name of the entity that publishes that?
IPMA is International
IPMA. Okay, got it.
Play Equipment Manufacturer Association.
So the same company. All right, thank you. Thank you again, Mr. Ayong. There are two more. I think Vanessa Singleton.
After hearing other people's testimony, it dawned on me that, yes, the cost about putting in the playground, the cost it would be, but also maintaining it over time. Even with just basic toys, I'm completely replacing sometimes 6 months due to the harsh weather here in Guam and the rain. And by getting the permit, if you go to other playgrounds, you say they can put caution, you see caution tapes like at community playgrounds because they're waiting for parts to come in or to repair it. So if a child care has a problem, maybe something happened to the ground or our equipment, and we need to replace it with off-island, and it takes time to ship, are we able to put the conscience and still be not docked on that when they come to inspect us? So so that's one concern, was the cost of maintaining it, because if everyone's followed with the military, even with their nice facilities that cost $500 to $700, they've had many issues with the roofing, the covering, and also with the ground. They've had to replace a few grounds because they found complications with the ones that they had. And there was one more. But I do want, because being in child care, my biggest fear is having a child get hurt. No one wants their child to get hurt or someone else's child to get hurt. And we do our best to try to protect them. But also at the same time, you could put a child that you try to protect them as much as they can, but they find a way to hurt themselves. And I've had that cases where, because we don't have a big playground, so after school we take them to the community playgrounds. And so we're like, okay, well, this is good, this is safe. They play at school, they play here, but somehow they find a way to hurt themselves. And it's like because they're excited, they hit their head on jumping down on a monkey bar or the seesaw, it hits their chin from the, so I know it won't completely protect them, and we don't want any child having amputations or head injuries or paralyzed, because even with the Little Tikes toys, even at 2 feet tall, I cringe when I see a child up there, because all it takes is just one little misstep and the child will tumble over. But luckily Guam, as far as I know, has been blessed with not any significant injuries on the playground facilities in our community. I just wanted to add that the costs of maintaining, when we have to get permits yearly, if they could be a little lenient, like 3 years down the line or after a typhoon, if something comes up. Thank you.
Thank you very much, Ms. Singleton. Marian Ann Santos?
Yes. Hi, good morning, Speaker Terlaje, Senators. I'm Maureen Ann Santos with Adventures in Learning. So just a few things. We do have a small playground. To other centers, it might be, relatively bigger, but so we do use that same playground for all our children, to come out and play. And of course, they don't all play at the same time. They have their schedules of playtime, and they alternate outside. One concern would be the labeling and sectioning off the playground, because throughout a day, the children will come out and different ages will get to play with different things. And also removing some playground equipment we move things often to the side to give, depending on the activity for the day. We do have portable play activities like the parachute. The children will bring out and they play that in the yard because it's a bigger space. And for those who don't know, it's where they all hold a corner of the parachute, like a big blanket almost, and we put a ball in and they get to play with that. And it helps them with their motor skills and colors, things like that. So we're constantly trying to develop them and in all their domains. And being able to move things around in the playground is one of the things that we find helpful to them, depending on the needs of the day. So the Little Tikes seesaw and slides may not permanently be set where we put, when we put in our application for our permit, it may not be there because we will move it off depending on needs. So that's something that I'm concerned about as, director in the center. What can we do, as far as those? Because I fear of not being compliant with, we're not following what we submitted in when we got the permit. So that's one concern. And the other ones is broken toys. We often remove things. We're checking teachers even throughout the day. A toy in the morning or a play equipment may be fine, and then later on we notice, there's a chip or something, so we remove it when we can. This happens quite often, so I guess I'm wondering a little more clarification every time we remove something from the playground and then put something back in. Would we have to go through, DH every single time and turn in and submit a form? I want to say within a month we probably remove 5 to 10 things, and that can be tasking for us as well as public health on their end. Thank you.
Thank you so much, Ms. Santos. Okay, is there anyone else here to testify on this bill? If not, then I will open it up to the panel for questions. Thank you all for your testimony. Senator Fisher?
Thank you very much, Chair. Just a couple of questions. I guess this will go to the Department of Public Health, and I'm referring to page 3 of the rules and regs, particularly the definition of child care facility. Do you believe that this definition, here's a hypothetical. I have a child and I've got to go to work, and I give the child to my neighbor to take care of during the day. Is my neighbor now a child care facility? And keeping in mind I'm not related to my neighbor.
Okay. So thank you for your question, Senator Fisher. The definition cited in these regulations was actually taken from Title 10 Guam Code Annotated. I just forget the chapter. I can look into that, but it's called institutional facilities. So we lifted that definition and adopted this in here. So for the purposes of this institutional playground regulations, any childcare facility or school that is licensed by BOSA and has secured a permit with our Division of Environmental Health will be under these regulations. So your question is, if your neighbor decides to put up his or her own childcare facility, if that,
no, that
no? Okay.
What I'm thinking about is literally a babysitting situation.
Okay, so that wouldn't be considered an institutional facility if it's not permitted by public health.
Okay, because the definition for child care facility has no permitting requirement in it. So you may think about including that a child care facility is a facility that, among other things, is licensed by public health. Because I think that the only saving grace I could find in the definition was the phrase providing regular care. That might eliminate the whole babysitting situation. This is just a drafting issue, so if you want to think about that. Let's see, there was just one other thing I caught. I'm on page 7, section 426005, institutional playground permit. And I see that you're there. Okay.
I'm sorry, sir. Can you repeat?
Yes, it's on page 7 of the rules and regs, and it's called institutional playground permit.
Okay.
Okay.
Yes.
All right. The second line at line 14. Well, no person shall directly or indirectly in any manner conduct, control, manage, maintain, or operate a playground at a child facility. Did you mean to say child care facility there?
That's right,
Okay.
Senator.
I would just suggest that, you can just drop that in there.
Agree, thank you.
Otherwise, you guys are the experts, so I'll defer to you. Thank you.
Thank you, Senator Fisher. Senator Taitigui.
Thank you, Madam Chair. I understand the hard work that Public Health put in this, and you've been working on this for quite some time, and it's definitely most needed. But, I have to be taken back about the testimony from Joe Sanchez, DOE. My big concern is that the more requirements that are required, the more possibility for a suit. You add more rules and regulations, opens the door. If you don't have that one thing there, there's a lawsuit. And we're not just talking on the government side, but on the private sector as well. It's the cost is significant. In a perfect world, to have some of these equipment at a reasonable price, I'm sure that we would have gotten this a long time ago. But I am really weary about the requirements here, especially with DOE. So I really don't have that much questions, except the timeline. Is it like the cosmetology where it's 3 years, it'll be implemented? What is this one?
This one is 2 years.
Only 2 years?
Senator. Yes. Yes, and if I may address your question
Sure.
also. So, as I mentioned in our testimony earlier, a playground or playground equipment is not a requirement in childcare facility or school facility. If there are issues with funding, such as what Mr. Sanchez has mentioned, they actually, GDOE can opt, to include other recreational facilities that won't require a playground. It can be an open space, but any other recreational activity they can provide. Also, to your point that it may result, the rules and regulations may result in lawsuits. I feel like if a facility has a playground equipment that complies with national standards like the one provided by Consumer Product Safety Commission, that will actually, help the child care facility or the school to defend their case by saying, our equipment complied with the national standards, and that may, I just feel like that's gonna help their case. Thank you.
Joe, would you like to say something? I know you were ready to say something, please.
Yes, thank you for that, and thank you for the sentiment, because we actually did have some conversations around that where we just won't buy fancy equipment. It will be more like balls, jump ropes, and we actually do have a training for teachers called Sparks, which is kind of like like an introductory sports training for elementary school that requires very little equipment. It just requires, again, jump rope and markers that you put on the ground. So we're really trying to think through, based on the checklist, what would actually be needed to be done at every school and cost that out and see if there's some alternative ways that we could provide students with opportunities to play outside versus having to purchase all the expensive equipment, which would then require more regulations and so forth.
So that kind of limits now the ability for our school children to really partake in a lot of activities, some that have proven to be, healthy for them and get them involved and interested in. And I'd hate to see that we had to, down it, just so that we can meet these safety requirements. I understand safety is priority, of course, but if we can find, alternatives to purchase what needs to be done to make them safe, especially, Joe, the surface seems to be an issue as well. Like Amazing Kids, when they brought up their testimony, the cost almost $30,000, for this. And this is just a small daycare. I mean, the daycares are having a really difficult time right now. I mean, that explains why, money is being pushed to the daycare facilities. But
we anticipate
the surface,
that to be the most cost.
Sorry?
We anticipate that to be the one that's the most expensive.
The surface,
and,
right?
Yeah. Not to be facetious, but when we were discussing it, we have to kind of assess how important is it for them to climb. Mm-hmm. So if we can't afford the fall protection, right. We just won't have equipment that requires them to climb high. But there's so many other activities where they can run and they can play and they can have. I know it can be viewed as taking away from an opportunity, but if it does come to that where we don't have the funds to pay for the fall protection, we just won't have equipment that has them climb high.
Well, you got to remember too, even in the grassy areas, there's rocks on the ground. If a child slips and falls and hits a rock, you don't see all those rocks on the ground. I mean, Joe, do you think 2 years is enough time for GDOE to be compliant?
So no, we don't believe so.
I didn't think so either. We're giving cosmetology 3.
Last year when we were looking at the capital improvement projects and the expected timeline to get those done, we were a lot more optimistic at the time. We're like, oh yeah, we'll get this done. We'll do this. Mm-hmm. This past year, things are moving a little faster. But even as the deadlines approach, we have 18 months to do all of the ARP, CIP projects and so forth, that right now we feel like adding this on, although we believe it's important, we want to come into compliance with it, we might not be able to do it within the 2 years. They haven't been scoped out yet. We haven't done the assessments. Although playground equipment was originally in our ARP plan last year, because of the cost of all the other priorities, plumbing and electrical and roofing, it kept getting pushed down. You know, and right now we're not sure if we'll be able to afford it. So we don't have the background planning set up yet to initiate this.
Okay, well, thank you so much, Joe. And I really want to thank you, too, always taking my phone calls whenever I had a question about GDOE. You've been very, very helpful, and I appreciate your hard work that you're doing. And thank you to Public Health. I hope you may consider the timeline to be stretched out and even find other alternatives to, you know, allow more activities, but keeping the safety perspective, but not going too overboard. So, thank you so much, Madam Chair.
Thank you, Senator Taitigui. Senator Dueñas.
Just Masi, Madam Chair, and thank you for everyone for being here. It looks like we have a little bit of work to do, but I think Benson made probably one of the best, cases for the fact that we just used that certified and that handbook that's nationally recognized, and maybe we can just put a section in the regulations that says, the latest updated. And that will allow us, that actually would naturally update because of the fact that it would be the latest version. So it should comply and not contradict with what's in, the current regulations. Just a recommendation.
Yes, if I may address that, Senator Dueñas, thank you for that. So Mr. Mr. Benson was actually referring to handbook by IPMA, correct? IPMA? CPSC? Okay, so that one is the edition, that's the 2010 edition, right? Yes, so that's actually the version that we used. And yeah, maybe you have I think you have a point that we can probably write in there, because Public Law 31-73 mandates us to follow the CPSC's handbook for playground safety. Maybe we can add a language there that any updates to that CPSC handbook would apply to.
Yeah, I think that's why Benson was pointing out the conflict, because there is updates that come up. So if that's what we're following, I think it might be, I'm not saying it might happen as an amendment, it might not, but maybe we'll reach back to you on that. The other thing that Mr. Chang, you mentioned, and I think it was a concern brought up overall, so it looks like what you were talking about is doing your full surface on the fall protection equipment. I mean, is the fall protection required on the full surface, or just the areas where the equipment that may comprise of a fall potentiality?
Well, I don't have the exact portion, but I believe, according to what my interpretation, there's one section that states that the ground cannot be concrete to begin with. So in our case, our entire playground is concrete, fenced in, so we have no choice, but we have to surface it one way or the other. So it's going to require 2,000 square feet of surfacing. So that regardless of if there's a equipment that's bigger that the kids can climb on. I mean, even if we just had playhouses and small stuff, it states there that concrete is not a allowable surface, along with I believe dirt, loose materials.
Okay, I can clarify that. So, as mentioned earlier, CPSC has determined that falls are the major hazards in public playgrounds. So, the requirement for impact attenuation or surfacing requirements is only within the use zone. The use zone is defined on page 7, line 9, which shall mean the surface under and around the piece of equipment onto which a child falling from or exiting from the playground equipment would be expected to land.
That's why I'm trying to help you, Mr. Cheng. I think, I think you may have, you know, I mean, this may be a good resolution because I think it's within the area as described that.
So point of clarification, in our case specifically then, surfacing under and surrounding those particular type of equipments, of course, is required. The rest of the playground where there are no such type of equipment, I can leave as is?
That's correct, sir. So only for the elevated equipment where a child will likely fall.
Okay. Thank you very much, Senator.
I'm trying to help you.
I greatly appreciate that.
And it also helped the other gentleman, because the other gentleman's issue was the fact that if they had to put all of the tiling, it doesn't work with some of their play materials where they do chalk lineouts and things like that they could possibly clean and then redo it with the children again with their creativity and the like. So that would be kind of difficult to constantly do that on that surface, whereas on a concrete surface or whatever, they said that they have asphalt, that they would be able to do that. So I think we may have clarified a point for you, sir, and it looks like the recommendation is only within those areas where you're providing that equipment.
Thank you very, very much for the clarification.
Absolutely. Madam Chair, that's really all I had. I think there's some great markup points here, and I don't think they're overbearing. I do agree with the issue with Department of Education. I think you have that flexibility because you got large land mass to work on, you know, your open areas and do what you need to do until you can come into compliance, and then otherwise it will be taken into consideration as we move forward. But that's all I have, Madam Chair. Thank you.
Thank you, Senator Dueñas. I have a couple questions from Senator Barnett. One is, what plans are existing already or underway for GDOE?
Are you talking specifically for playgrounds?
Yes.
Really, it's just the initial review. So originally last year, under the ARP funding, playground equipment was actually part of our overall capital improvement plan and projects. But sometime around October or November, due to kind of the budget that was estimated for all of the other priorities, it kept getting pushed down. So what was supposed to have happened was a full assessment of all the playground equipment. We didn't have the checklist until we received it, or if someone did have it, they didn't share it with us. But we used the checklist just recently to get a cursory review, you know, of what some schools might be able to, you know, to be compliant. So that would have been kind of like the main thing, is do an assessment of all the schools, cost out the plan, and then make sure that we're able to identify the funding.
All right. And public health, how often do you inspect these playgrounds?
Madam Speaker, right now, because this is a new regulations and no one is permitted yet, we haven't done any regulations. We did actually have a couple of certified playground safety inspectors a couple of years ago, but fortunately they resigned. So we're, you know, beefing up that training also, and the 2 years that is given for all the facilities to come in, the existing facilities to come into compliance, will give us time for staff training as well, and also education to provide to the childcare facilities that we inspect quarterly. So to give them ideas on, provide guidance on how we can help them comply.
Okay, great. And so I want to just clarify again, because I like the idea that if we have some national standards and you all agree that those are what we should be complying with, then, so you're saying that 10 GCA mandates that we comply with the U.S. Consumer Product Safety Commission's Public Playground Safety Handbook.
It's actually Public Law 31-37, Rules and Regulations.
73? 31, you cited on page 3 of the rules, 426002, you said Public Law 31-73.
Okay.
Page 3.
Oh, page 3.
426002.
Okay.
Is that wrong?
It's adopted pursuant to the Public Law 31-73 and Chapter 20 of 10 GCA, which allows us to promulgate rules and regulations.
All right, but does it mandate Consumer Product Safety Commission's
The Public Law 31-73 does.
73, not 37, right?
Yes,
Okay.
73, I'm
Okay,
sorry.
okay,
Yes.
great. So that one mandates this, and if we change that law to say we shall comply with the
most recent.
How often does it change?
Yeah, the latest one that CPSC has is 2010. So
Okay.
it's been years.
Yeah. All right. I'm just going to consider that. Benson, would you say then that the U.S. Consumer Product Safety Commission's Public Playground Safety Handbook is the same as what you were referring to earlier, the EPIMA, or different?
Yeah, this is the one that I have, and it looks like here it's printed 2010. However, that line that I mentioned about the
Yes.
swing, it's different from
Right.
what is here. I mean, my suggestion is you can still be compliant with the law to follow the handbook. You just don't need to make the handbook the law. You
Correct.
You can still have the certified playground safety inspector to follow the handbook and, inspect the playground and,
Would public health have any objection to saying that playgrounds must comply with this handbook?
Well,
are there-
majority, I would say 90+% came from the book, really, the technical specifications. The other things that we added is really how we conduct sanitation inspections, how we grade them, how we conduct pre-operational inspections. So
Okay.
those things were added into it so it aligns with what DEH has been doing for all the other
Okay.
health-regulated establishments.
All right. Could we work together to delineate those sections? All right.
Okay.
And then, yeah, so I did expect that these guidelines would cause a cost concern, of course, with daycare. Are they able to install playground equipment according to these guidelines and then move them around? Some of these daycares, that's what they want to do in order to have bigger play areas.
Well, it's similar to other health-regulated establishments. When prior to issuing the permit, we have to make sure that the structures and the safety requirements are met. So whenever they move something, similar to food facility, they just need to submit a new layout of the equipment. And then anyway, for childcare facilities, we do visit them, conduct inspections every quarter, so we can go ahead and just verify if the new placement of equipment still complies with the rules and regulations for playgrounds.
All right, is it possible to get like 2 layouts approved in advance, right? One with your regular and then one on special occasions when you need bigger areas,
That may
something
be,
like
yeah,
that?
that may be, yeah.
And then what if they brought in a new, like Little Tykes Playhouse, I can think those are called, and you put them down? That's not allowed anymore?
Okay, so we actually reached out to the manufacturers of this. They're actually considered home playground equipment. They're only for homes and not like institutional facilities or playgrounds. So the manufacturers are very, adamant that these are only for the homes and shouldn't be placed in childcare
So they don't want to
facilities.
cover the liability for commercial purposes or institution purposes. What about public playgrounds? Does DEH monitor public playgrounds in parks?
We actually don't have a mandate to inspect or permit public playgrounds, only the institutional facilities
Okay.
as required in the public law that I mentioned.
All right, and you specify in here that institutional facilities for sure are family daycare homes, foster family homes, group daycare homes, residential treatment facilities, daycare centers, day nurseries, nursery schools, kindergarten schools, daycare homes, or similar institutions or units regardless of name.
That's right.
All right. Is there any way to come up with a rule, or Benson, do you know if those guidelines have any different rule for children over the age of 10? Because right now we're lumping every child over the age of 4 in the same rules. And that makes me think that when we have those high swings that the elementary schools you'd like to use, they would not be allowed unless they've got the the good surfacing, right? But even for older kids, we're saying that's the rule.
This is required also, yes.
I know this is a GDOE's concern, that's why I'm bringing that up. So right now, we don't see any distinguishing between age groups of child. The threat or the risk is the same.
No, there's actually a requirement for age separation in the rules. The 4 years and above is only for supervision, but in terms of playground equipment, we actually, the CPSC handbook actually provides guidelines to make sure that, you know, the little children, like the less than 2 years old, are separated from the more active big children. That's why we require like age separation in the form of benches or shrubs, so these kids don't collide with each other. So this is also provided in the...
Do the rules specify what type of equipment is okay for what type of age student?
It's written here, there's some guidelines, but not like, you know, for each age group. It's only for like the big age gaps.
Okay. All right, thank you. All right.
Speaker, let me add
yes.
to that.
Mr. Ayo?
There are playgrounds that are all separated into different age groups.
Playgrounds separated by age
From
group.
the manufacturers, there's yeah. So
oh, you mean they're by the manufacturer specified for certain age groups?
Yeah.
I see.
Some playgrounds are not suitable for younger child,
yes, that's
for
what
instance,
okay.
and they are separated.
So that's correct. So that's why the regulations also require labeling of playground equipment.
Okay.
Oh, yeah.
So to make sure that only this age group will be using this type of facility equipment.
All right. And if, again, back to the daycares, if they wanted to move their playground equipment and do a different, have a party or something, let's say, but they could mark those off with caution tape and say, don't use this area because they're not in compliance anymore, right? And that would be okay?
They could use that, similar to how GDOE does it when a specific portion of a school is not, you know, compliant or it's not safe, then they just cordon off that area and make sure there's supervision that children won't be using that area.
Madam Speaker?
Yes, Mr. Chang.
I do have one question regarding the separation of ages in the playground and separation of the equipment in sections, because, and specifically regarding childcare centers, because the majority of childcare centers really have small playgrounds. And so by doing so, it'll be very, very difficult. But how we handle it is that we bring the children out by age groups. So there's no intermingling of toddlers and pre-K kids at any one time. And so with regards to that, would that suffice? And then, of course, labeling the equipment appropriately and ensuring the staff are fully trained and aware and know what equipment is appropriate for what age group, and ensuring that, okay, when I have my 2 and 3-year-olds out there, they're not playing on equipment that's designed for the 4 to 6-year-olds, for example. Would that be acceptable?
So that would actually, you know, that's something that can be addressed via variance. So that's also included in the regulations. Because what you're saying is, instead of providing the physical barriers, right, to separate them, you'll just propose a schedule for each age group.
Yes.
So we can work with you when these regulations are adopted. We'll help you, you know, fill out that variance form. But again, submission of the variance form still depends on, you know, whether your alternative plan meets the intent of the regulations and does not create danger to the kids. And it still depends on the director for approval. Okay?
Absolutely. I appreciate that.
You're welcome.
Thank you.
Thank you. Ms. Singleton.
I had a clarification. Little Tyke's house were addressed in the first, but according to Mr. Josh, we are allowed to have Little Tyke houses. According to the new bill, it was taken out. Because she was mentioning Little Tyke houses, and then you brought up that they have to be commercial, it cannot be. But according to Mr. Josh, it's not in the new regulations anymore. It was in the prior one, but it's not in the new one.
Okay, so the regulations were not changed from ever since the administrative public hearing, but I know there were some notes during the minutes of the public hearing where the Little Tykes were brought up, but it was clarified during that time that Little Tykes, we've reached out to them, and even step 2, and they confirmed that their equipment are not for institutional facilities.
Is it safe to say then that the rules require institutional playground equipment, like
Commercial.
certified by the manufacturer to be institutional equipment, or else they're not allowed?
Yes, Madam Speaker. So the manufacturer's specifications would indicate if that equipment can be used for like a commercial facility, such as an institutional facility.
Okay, thank you.
So I'm still confused, and I need clarification in the future. So some people build their homes too, if they had a house built, what rules and regulations they would follow, because the Little Tyke Playhouse that is very durable, that's $600, I don't see an issue with it. But can you state where it is here so we can, where it's in that it has to be?
It's actually everywhere in the regulations where it says playground equipment has to be installed, and
so a house
have
would
do
have
a
to be
search.
installed?
It have to be installed and maintained according to manufacturer specifications.
Okay, so that's something we would have to review, because that changes the whole ballpark of our image of a playground that we've been talking about.
Thank you. I understand. All right. So manufacturer's instructions installation. Okay.
Yes.
Mr. Sanchez.
Great, thank you. Can I just go back to the ratio for supervision? I know that in the bill, it's at the 20-1 for 4-year-olds and above, but where did we get that as a standard? Because it does seem, because again, the Department of Education's policy is 150. So.
Sorry. It would be in the handbook, the CPSC handbook for playground safety. That's 2010 edition.
Okay. Yeah, because I think I'm on that section, but I can't find, there is a section on supervision, but to look at the ratios, I'm not sure where that would be.
I'll double check and provide you that one. Thanks.
Okay, so we're going to verify that the ratios for playground supervision are actually the ones in the most recent copy of the Consumer Protection Handbook. All right, and other items, we will take a closer look at this bill. So for that reason, I will continue to accept testimony on Bill number 93-37 COR for the next 10 working days, which expires on May 2, 2023. Testimony can be submitted via email to Senator terlajeguam@gmail.com or hand-delivered to my office here at the Guam Congress Building. I want to thank each of you. Your testimony has been very helpful, and I know that this industry is really precious to us. We do not want to kill it. We want it to thrive, and so we were going to have to, but we want the children to be safe as well with these rules, and I want to thank Public Health for their work on this. So thank you again to everyone for your very helpful input on this bill. Sizos Masi. The hearing on Bill 93-37 is now adjourned. The time is 11:10 a.m. Sizos Masi.